right, if folks don't mind having a seat, we have a pretty packed agenda for this Saturday, and we're so grateful to you all for coming today. My name is Lisa Patel. I'm a faculty at Stanford, and I'm so excited and just so honored that you all are spending your Saturday with us here. This is our 5th year of the NorCal Symposium on Climate, Health, and Equity. And it feels bittersweet because when we started this in 2020, it was the beginning of the pandemic. And a number of us were working with big groups of students that were deeply concerned about the climate crisis and concerned that we weren't taking the action we needed. And so the consortium was really born from this combined community effort, an all-in, we can do this together ethos that in this moment in particular feels extraordinarily important. And I will say personally, this week has felt tough if you care about climate and justice. But what I feel really heartened by is to know that this time we are well organized. This time we have very good community as demonstrated today. And I'm so grateful that you all joined us this afternoon. I'm going to turn it over now to my wonderful co-lead here, Dr. Manny Berengi. She has been instrumental in putting this day this afternoon together, and we're really grateful for her organizing. So Dr. Berengi is an occupational and environmental medicine physician, associate clinical professor at UC Irvine School of Medicine and Wen School of Public Health, and Chief Occupational Health at VA Long Beach. She's also the lead academic and community partnership for the UC Center for Climate, Health, and Equity. Thank you so much, Manny.
Thank you so much, Lisa. It's a real honor to be here today. So I'm just going to give a couple of introductory remarks, and then we'll transition over to the first panel. So good afternoon, esteemed colleagues, distinguished guests, and fellow advocates for climate, health, and equity. Welcome to the NorCal Symposium on Climate, Health, and Equity. I'm honored to address you today on behalf of the Medical Society Consortium on Climate and Health, as well as the Climate, Health, and Informatics Working Group through the American Medical Informatics Association. Our gathering today really represents a crucial intersection of science, technology, and social responsibility. We stand at a pivotal moment in history where the convergence of climate change, public health, and cutting-edge technology offers both unprecedented challenges and extraordinary opportunities. The climate crisis is not a distant threat, it's a present reality affecting communities worldwide. Its impacts on human health are profound and far-reaching, from exacerbating respiratory diseases due to air pollution to increasing the spread of vector-borne illnesses. The urgency of our mission cannot be overstated. As I'm sure all of you know, the election results have underscored the need for us in the climate and health space to reassess our efforts and seek bipartisan solutions to the climate crisis that benefits the economy and protects humanity's future. While this setback is disheartening, it's crucial to remember that all significant reform movements face challenges. As former Vice President Al Gore has written earlier this week, in a moment such as this, it is important to remember that all major reform efforts, from civil rights to the climate movement, suffer dark days. And this is surely one. We can mourn a loss, but we can't linger in despair. Our planet doesn't have time for that. So our work must press forward with renewed determination and engagement from all sectors of society. Despite the setbacks, past victories in reducing climate pollution provide hope for future success. The unwavering dedication of advocates, healthcare leaders, researchers, business leaders, and citizens worldwide remains a powerful source of inspiration to continue to strive for a less polluted world. We are here to explore solutions, to harness the power of informatics and artificial intelligence in our fight against climate change and its health impacts. Our focus is on improved mitigation, adaptation, and resilience. This symposium is a testament to the power of interdisciplinary information exchange. By bringing together experts from Stanford, UCSF, and UC Davis, along with local community and environmental justice organizations, public health experts, the tech industry, and informaticians, we create a unique ecosystem of knowledge and information, as well as innovation. Our diverse audience, clinicians, researchers, data scientists, climate scientists, public health professionals, and policymakers reflects the multifaceted nature of the challenge we face. It is through this interdisciplinary approach that we can hope to develop a comprehensive, effective solution. So I'll go ahead and give a brief session highlights for today's sessions. In our first session, Promoting Climate Justice Through Community-Centered Air Pollution, we will delve into the critical intersection of air quality monitoring, data analytics, and climate justice. We'll explore how advanced air quality data analytics can be applied to identify and assess environmental justice issues. We'll discuss community-centered air quality monitoring initiatives that empower local residents, incorporating low-cost sensor technologies and citizen science approaches. This session will also review evidence-based policy recommendations and advocacy strategies to address air quality disparities. In session 2, Advancing Health Equity Through Data-Driven Solutions for Heat Impact Mitigation, we will focus on leveraging scientific and health data to identify risk drivers for heat impacts, with a special emphasis on health equity. We'll analyze data from California and Arizona communities, understanding how multidisciplinary collaboration can influence the development of technological solutions to mitigate heat-related disasters. We will learn how to develop a data-driven extreme heat ranking system that integrates diverse data sets and provides actionable insights to mitigate heat impacts equitably. And in our final session, Dr. Chetan Sarabu, who's here, he's my fellow colleague. He will lead the discussion on sustainable practices and the utilization of AI in healthcare. While AI holds tremendous promise for addressing climate and healthcare challenges, we must also consider its resource demands. He has put together a very exciting segment exploring strategies for implementing AI in energy efficient ways, with a focus on how healthcare organizations can lead in sustainable AI practices. This session will provide insights into the environmental challenges posed by AI, highlight energy efficient AI strategies, and examine how healthcare organizations can balance AI implementation with sustainability commitments. As we engage in these sessions, I urge you to consider not just the technical aspects of the solutions we'll discuss, but also the broader implications. How can we ensure that our technological advancements serve all communities equitably? How can we balance rapid innovation with sustainable practices? Remember, our goal is not just to develop new technologies, but to create a more resilient, equitable, and healthy world in the face of climate change. Each of you plays a crucial role in this mission, whether you're developing new AI models, crafting public health policies, or advocating for environmental justice in your communities. So let's get started. All right, so I'll go ahead and introduce our first panel. Let me go ahead and provide a brief overview of who's on our panel today. So we have Marshall Burke. Go ahead and raise your hand. Yeah. He's an associate professor at the Dorr School of Sustainability, as well as deputy director for the Center on Food Security and the Environment, as well as principal investigator for environmental change and human outcomes lab. Darren, go ahead and wait. There you go. Oh, so he actually came all the way out from Detroit. So go ahead and give him a nice round of applause for coming all the way out here just for us. He is the co-founder and CEO at Just Air, which is a small and growing team dedicated to the belief that everyone has the right to breathe clean air. They strive to be true collaborators with environmental justice leaders, resident groups, governments, public health advocates, and industries who are committed to making air quality information more accessible. And last, but certainly not least, Matt Wolf, go ahead. Yep. Yeah. So he's a local. He is here based in San Francisco. He's the Climate Health Program Manager at San Francisco Department of Public Health, and he uses qualitative as well as quantitative resources to assess how climate change-related weather events will impact the health of San Franciscans, as well as predicting which San Franciscans are most likely to suffer these impacts as well. So, and then we got our student moderators. So I'll go ahead and provide a brief overview of who they are. So Christina? All right. Yes, so Christina is a first-year medical student at UC Davis, and she's interested in the impacts of climate change on respiratory health. And Pedro, hey Pedro. And he is a first-year medical student at UC Davis as well, who has firsthand experienced the impacts of climate change while in the midst of the wildfires in Northern California. And he continues to do research on the impacts of wildfire smoke on Californians' health. So I'll let you guys take it away.
Hello, testing. Okay, I think can everyone hear me? Okay. So our first question is just going to be more of like a little icebreaker. This is for all of our panelists. And so the question is, how did each of you get into the climate space? Specifically, what inspired your interest in climate change, air pollution, quality, and what are you doing now in this area?
Yeah, I guess I'll jump in. Well, first off, thank you all so much. It's really inspiring to have the space and hold the space for these conversations and having experts in the field take their time to share this. Darren Riley, what brought me to the space, I like to say kind of two sides of the equation. One, my education background, professional background, and two, my personal experience. So my education background and technical background, I'm a software engineer at Carnegie Mellon University. Coming out of there, really focusing on how to build IoT solutions for better outcomes, whether it be food. Did some cybersecurity stuff, did some other things around space. So I was really fascinated, just being fortunate to be in an institute like that, but also recognizing the places that I come from, being a product of the justice system, seeing not having some folks not having that circumstance or chance, open my eyes to, hey, I have this technical experience, but how do I make sure we're building solutions that make sense for my community? Leads me to the second part, personal. So didn't have asthma or anything like that growing up. I moved to Detroit in 2016, Southwest Detroit, and developed asthma in 2018. Crazy traumatic experience, just understanding how your body's working against you, but it opened my eyes to health disparities. I think typically I was taught like, Black folks probably more likely to get asthma and it's a genetic thing and et cetera. But the fact that in my neighborhood, you have such a diverse array of folks, all have a through line of similar diseases, cancers, and respiratory illnesses, it's opened my eyes to the health disparities. And so fast forward, COVID happened, we saw the disparities even more. And I was like, hey, let's do something about this. And I really was interested in how we improve behavioral change, improve environmental change, and policy change at intersection of data around air quality, which we'll talk more about. So I got into the space.
Great. It's also, let me thank the organizers. Great to be here. Thanks for inviting me up. So I was trained as a development economist, so my PhD is in economics, and didn't start out really that interested in the environment or tangentially interested in the environment and air pollution. But I think anyone who's traveled extensively in low and middle income countries can't help but be interested in environmental exposures and their impact on populations. Urban air quality is obvious to anyone who's traveled right throughout the rest of the world, and its impacts, I think, are also, fairly obvious, and so it's hard not to be interested. So I think I got interested initially that way, and then of course living in California, over the last decade, we've seen very viscerally how things can change for the worse rapidly with growing wildfire exposure. So it's hard to live here and have quantitative interest in the relationship between humans and their environment and not want to work on these issues and help. And so most of my group and my lab's work is now centered on these sort of issues.
Hey, everyone. I'm Matt Wolf. Thank you so much for having me here. This is really exciting. So my background is in urban and regional planning. It's where I got my education in. And I kind of took a circuitous route like everybody else. And I got a job with the Department of Public Health. And what I noticed from heat events and wildfire smoke events is that everybody looked to the Department of Public Health and the Department of Emergency Response to lead in the response to these events. They were looked at as health issues or emergency response issues, but then the health department and the Department of Emergency Management, as soon as the heat event ended or the wildfire smoke event ended, had to go respond to the next issue, and then had to go to respond to the next issue, and had to go to respond to the next issue, because that's the way these departments have worked forever, and there's not a lot of long-range planning. And I'm really interested in where my work has really taken me is how do you use the power of health data and the power to influence projects that aren't health projects. So I manage the climate health program. We're funded through a BRACE grant from the CDC, Building Resilience Against Climate Effects. And I'm kind of a bridge. So I bring a climate change perspective to DPH, but then I'm the health person in the room at the citywide climate action plan, at the hazards and climate resilience plan. And right now I'm managing and facilitating the city's heat and air quality resilience plan, which is HAQR, Hacker, for San Francisco. And so what what that's really taken me is how can you work with health data to get, that green infrastructure impacts air quality and heat. How can you use health data to influence what our Department of Public Works is doing? We know that housing quality impacts it. So how can we work with our planning department and find these areas of synergy? Because like climate change, forces us to all to work more interdepartmentally. So that's kind of what I'm doing now.
Thank you, everybody, for sharing your journeys towards climate justice. It really allows us to reflect on why we're here today. So we're going to go ahead and jump into our first question. And our first question is going to be directed towards Marshall. And that question is, how have recent technological advancements improved our ability to monitor, analyze, and alert air quality?
Great, thanks for that question. Yeah, it's a really exciting time, I think, to study air quality. And it's bad in the sense that we have a worsening air quality, but it's good in the sense that we have a lot of new data and technologies that can help us better measure who's exposed to what, and then hopefully use that information to do something useful. So let me highlight 3 changes that really have, I think, fundamentally affected and changed, improved how we can measure at least ambient air quality, also indoor air quality, which is our ability to measure that is getting better as well. But let's focus on the ambient, so the outdoor stuff. So number 1, satellites. So satellites, people recognized long ago that satellites could be useful for measurements of air quality, but we've launched a lot of new satellites and sensors in the last 5 to 10 years, and many of these are high resolution or high temporal resolution, meaning you get a lot of images per day, and these are just really useful. They provide a lot of different reflectance bands that are useful for measuring how much dirty stuff is in the air. So satellites is number 1. Number 2 is new technologies from computer science, from machine learning. So technologies and architectures from machine learning that can help us extract useful information from the satellite image. So how do you figure out what to look at in the image? These are massive data sets. So how do you search through them efficiently, right? And computer scientists have really given us some gifts in terms of new tools to be able to interpret and extract meaningful data from these really, really large satellite data sets. The final one, and the inescapable thing that we always need, though, is good ground truth, right? A satellite-based model is only as good as the data that it's trained upon, usually. And so we need good training data. In the US, we have a pretty good sensor network. So starting in about 2000, we have had about 1,000 and now roughly 2,000 around the US sensors measuring PM2.5. So the particles that I assume folks are familiar with, on which we have, again, decades of information from epidemiology and health sciences that is bad for a range of health outcomes. So since 2000, we've measured these in earnest on the ground, more sensors going in all the time. And now what we've seen in the past, I would say 5 years, is a rapid growth in consumer grade sensors. So purple air is the one that people see a lot. So these are not regulatory grade. They're not the really fancy ones that the EPA uses, but they're pretty darn good. And there's been a lot of work to show that they can make fairly accurate measurements of local air quality. So as people put these in their homes and outside their homes, it's become an increasingly useful data set to help train and validate these models that I'm talking about. So satellites, new architectures from machine learning, and new ground data that have really fundamentally improved our ability to measure what's going on.
Thank you so much. That's so exciting. That's great to hear. Movement in the right direction for sure. Our next question is for Darren. How are cities leveraging smart city technologies to gather real-time air quality information? And what role is artificial intelligence playing in analyzing air quality data, if any?
No, great question. I guess it's actually really, well, you did a really good job of organizing the questions. Definitely just flows great what you said. I think the last end of that is where we kind of come in is around sensor technology, right? So the advancements in technology has been incredible. One gap, as we mentioned, 2,000 reference monitors. Some cities may have only 1 reference monitors. And studies out today have shown and proved that those reference monitors, especially in urban environments, have a very limited range, right? Somewhat to 5 square mile radius up to 10. And that's kind of being very, very conservative there. So you can imagine a city or a county like Wayne County or a city like Detroit that's really expansive, having only 2 or 3 or 4 it's not really good coverage, especially where you place those monitors. So where the sensors really come into place, purple airs, some consumer ones, some near reference ones like an AeroQual, Quant, AQ, some of these other monitor suppliers are able to kind of fill in those gaps at a lower cost. And the role that Just Air plays is normalizing that data and the quality assurance of that information across all monitors. So look at Just Air as a way to take a purple air sensor and kind of turn that into a high performing instrument that we could depend on. I won't go too much in details, but I will add just one example. So one example, like South Coast Air Quality Management District, they have a sensor program. I think you all have AB 617 or somewhat. And how do we control for when these monitors go into community to make sure that they're sited accurately, they're maintained accurately, et cetera? Our platform does that automatically, but two, also helps with the quality control. That purple air that is giving a purple reading or very unhealthy reading, where is it? Is that someone's house is plugged into a power strip? Typically power strips at a house, maybe over a barbecue. That could be polluting the air. So again, the accuracy, the siting, how are we really making sure that the data we trust, that my grandmother, my aunt coming out the door and look at that phone and look at the air quality and know that that dot is trusted where they can make the decision. So that's where Just Air is playing. And the way we really approach this really through the lens of environmental justice, consent, permission. When we deploy monitors and we put anything in somebody's neighborhood, it's really important to inform folks what that is. What is it doing for them? It's not against them. It's not surveillance. It's something that you have access to, you have autonomy over, and it's going to help you move in the right direction. So that's something that we do. We're not your typical tech company. We're really moving at a human pace to make sure we deliver excellence that our community deserves. In terms of AI, with the limited time we have, I'll just kind of give you two examples of how Just Air is using AI today. So the two primary use cases are one, quality control. How do we catch anomalies? We manage 100 monitors in Wayne County, largest county in Michigan, highest rates of asthma. Holds Detroit, which is the third worst place to live with asthma, according to the Asthma Allergy Foundation. How do we deploy an extensive network that measures what matters, but also ensures that it has quality assurance? So we have a small team. So how to manage that is to use AI to catch when there is a rate of change that was suspicious or PM cannot be negative, automatically turn that monitor off. We have a cluster of 5 monitors over here, but one monitor seems to have a crazy anomaly. Let's put a yellow flag there, is to tell communities in synchronous that hey, there's something going on. Take the reading for what it is, but there could be something going on. Maybe someone's burning their leaves, their fall leaves, which has actually happened. So give you that picture. So quality assurance. How do we automatically detect patterns in the network to give us as operators to ensure we have data quality? The next one, which is probably the most exciting one for you all, is deriving insights. Right. Two things I talk about: source detection. PM10, for example, from fugitive dust, certain policies around that, understanding the pattern of that with wind direction, topography, is very extensive data set, catch that on the fly. So over time, in a quarter span, we can look and analyze that data, combine some of those parameters to have a degree of probability confidence that this pollution is PM10. It's typically on Wednesdays coming from this concrete pressure. So being able to triangulate, almost like the FBI cell tower, trying to catch the bad guy, we're trying to do that, but for pollution, right? But I think what I'm really excited for is a day where we can really advance preventative health, right? Hey, we notice on certain days or certain time periods in this zip code that there probably is going to be an extreme usage of inhalers, which we'll talk about a little bit later, or with the smoke fire and topography, and we know the industry around, there's going to be something happening here. How do we, a week before, ensure that people know how to use their medication or refill their medication, understand that mothers and parents who have children who are asthmatic understand what to do and prepare themselves for next week? So that's how we're using AI. So one, how do we have a quality network? And two, how do we drive action and change from that air quality network?
Thank you, Darren. Excellent answer and gives us a lot of food for thought. Our next question is directed towards Matt. And the question is, how can we ensure equitable access to air quality information across different communities? And what are the mechanisms to do this? And what are we doing here in San Francisco or other cities across the US?
Thank you for the question. And I got to say, you guys I'm learning so much just from hearing what you guys are saying. So in San Francisco, we have a few different air quality networks right now. We're one of those cities with one National Weather Service monitor in the middle of the city. We have one Bay Area wide, we get modeled data from that one sensor that kind of evens and flattens it out. We have, a ton of purple air monitors. I know from the city side, we're hesitant to use those purple air monitors for like wildfire smoke activation because they all say slightly different things. So if whether I'm thinking about it from the city side when we decide that, okay, we have a wildfire smoke emergency response grid. Once AQI gets to a certain level, then we take these actions. That's the kind of the way we operate in emergency response. And if we have a bunch of monitors that all say slightly different things, it's really difficult to figure out whether the truth is. And so we use that National Weather Service one, but we know San Francisco has microclimates everywhere. So this is one thing. And we've run into problems when it comes where someone is saying, the air quality on my app looks really, really bad. The air quality in the monitor looks really bad, but you haven't activated yet. What's happening? So I think it cuts both ways. And I think this gets into the importance of the work that you guys do to make sure that there is like an established truth that is defensible. And then it's our job to build the policy on top of that in a really important way. When it comes to like equity, I think that this is a major barrier that we've had. And when it comes to wildfire smoke messaging, we push it out and we send out alerts. We have like a text-based alert system. It's translated into, I think, the 6 languages that in San Francisco. We also partner with our community-based organizations. So we send out alerts to the CBOs who then amplify that alert to their network. And that's hoping that we'll end up with the broadest group. And then we have other types of monitoring as well. Like there's community air monitors in San Francisco right now that are being run by community-based organizations. And those are doing the work of capturing like real-time pollution outputs, and then using that to then advocate for policies at the state level. And then one of the things that we have an AB 617 process as well. And one of the things I just presented to them on is the Department of Public Health has modeled air quality, or I've just learned about this, attributed air quality data. So we take all of our permitted sources and we say, this is what we imagine it's going to be per year, all of our roadways, and say, this is what we assume it's going to be per year in our ports. And we end up with a map that says, this is our air pollution exposure zone everywhere that it's, I think, over 10 micrograms per meters cubed. This is our air pollution exposure zone. And then we put policies based on that. So we have like enhanced ventilation requirements in those zones. I've now learned that there's like limitations to that method. And I think that this is one of the things that I think, it's why we need to ground truth this data and why that kind of is important as well.
Add a quick comment on the I think that's one great thing to help inform folks while we're in the space is like around model data. A lot of at least in certain states have better, like California has a really amazing model data using CalPUF as a system to look at a little bit of atmospheric chemistry to really model information. Some folks don't do that. But as you mentioned, not everything gets captured. And I think the question that stumps folks is, what are the limitations of the model that you're using, and what are the assumptions you're making, right? Because the chemistry, July 4th, what happens if someone in Southwest decides to do drag racing and chargers all around? This what happens at 2 a.m. in our community, and putting PM10 when the temperature is low and let that sit there in that topography. So I think the one thing, the beauty of having these low cost sensors is you get to tell those diverse stories in a one snapshot view, right? If someone just runs by and pops a firecracker right outside of here, that won't be captured on the reference monitor until the wind catches it, how many hours in advance. But with concentration data, we can see that moment right there that something happened, right? So I just want to add that model versus ground truth. I think it's really important to capture and how we can really address diverse experiences people are having.
Thank you so much, Matt. And thank you, Darren, for coming in with that assist. I think it's really important to address the fact that we're doing this research for the potential of interventions to ameliorate the negative health impacts. So I thank you for addressing that. Our next question. So we've done a lot of discussion about AI and how it's helping us. But do the advantages of AI in the analysis and monitoring of air quality outweigh the pollution that AI generates via its data centers? And this could address carbon emissions, methane, or the parts themselves.
I can.
It's a really quick one. I think it truly does depend. One, on the practical side, are we actually doing something to mitigate climate? And you can say that offsetting, get real granular about that. But at the end of the day, how efficient are we making our AI models so they have less compute? And there's also technologies that are trying to lower the heat and the energy it takes for certain AI. So the more information we have, the better we have to supervise some of our AI models. Unsupervised, totally different discussion, but supervise our AI models, the better we can be efficient to lower that.
And Marshall, I know you have experience in this field. I'd love to hear your take as well.
Sure. Yeah, I agree. Part of it is about being efficient. So there's been a lot of news on new data center growth. And actually, if you look in the big tech companies in Silicon Valley in our area, they, for a long time, were real leaders in decarbonization, right? They were some of the earliest companies, corporate efforts to get net zero plans in place, right? We're really out in front on this stuff. And in the last couple of years, if you look, and specifically in the last year, if you look in their annual reports on page 89 in a footnote, they say, oh, actually, we're abandoning those net zero commitments. And this is completely because of data center growth, right? Okay, so what are they using those data centers for? They're basically all for these very large foundation models that we're pretty familiar with now, ChatGPT being the first one, but now every company has its own, right? For the most part, and Darren, correct me if you guys are using them, but most of the insights that for air pollution measurement and monitoring are not using those models. We're using much cheaper, computationally speaking, and carbon speaking models that are not the ones, at least right now, that are responsible for a bunch of the data center growth. So the straight answer to your question is I think we're learning a lot more, and the value of the information right now it far exceeds the carbon. But if we don't use them responsibly and we start just running silly compute on these large foundation models, I think that could reverse. So I'm completely with Darren. We need to be thoughtful and efficient in how we use the models. So far, I think people have done a pretty good job, but it could still get out of hand.
So the one thing that will get out of hand, we talked to a major corporate on ESG, and they have generators. It's the generators that are back in the data center. So in Virginia, if there's a outage and those generators kick on, the black carbon and pollution coming from generators, that's an emergency. So I think that's another part is like, what are the incident response around some of the power usage can be an issue.
Yeah, how do we power exactly the data centers? And so it's gone both ways. We're actually building clean nuclear for some of these. Some of them are being sort of powered by hydro or renewables. Others, they have unmothballed coal power plants in the East Coast and are using coal, right? Which is the worst, probably the worst thing we can do. And so it depends on how you use the model, but it also depends sort of on where you use the model, to Darren's point. So
thank you for those answers. Very concerning, but also like seems like we're going in the right direction.
so far, yeah.
So far. This next question is going to go to Darren, so we could follow up on this one. So following the collection and analysis of data, how long until the real-time change can be implemented?
Yeah, this is my favorite question. So just there, we look at change in three categories. One, behavioral change, and it's one of the most annoying, but fruitful, low-hanging fruit. Two, environmental change. What can we do in our environment, to improve or make our communities more resilient? And three, the North Star policy, right? What policies can we put in place? Cumulative impact law, fugitive dust ordinances, reroute trucking ordinances, zoning laws. What can we put in place to really protect long-term health and wellness, so especially the more overburdened communities? In terms of the time, I think the time is probably shortest term. Behavioral change, there's been studies. We're even seeing information anecdotally that the more you know, the better you are. I can see that, but also we do some surveys, large-scale surveys in our platform to understand that people are making better decisions. They know what AQI is. They're spreading that word. Actually, it's funny, in my barbershop, they call me Mr. AQI, which is it's probably the biggest roast, but it's like you don't want to be called that. But they have QR codes and AQI, like the very health after the fires. People started to talk about air quality in these hubs, community hubs. So behavioral change, I think, is really important. I love what y'all are doing in San Francisco by partnering with those community organizations and disseminating the information, not going directly to the citizens, but going through the trusted vessels of where the communities want to get their information from. I think that's super important. On the environmental side is really fascinating what we're seeing here. Actually, one last thing on the behavioral thing. I forgot to show you guys this. You'll probably be excited about. We're deploying. We built this connected inhaler in Wayne County. Where we're doing a study looking at, one, does this information better help folks understand their triggers better? But two, what can this information do to influence policy change? We're putting 500 of these with a couple universities, studies in World Bank to understand kind of that those risks. And so when you trigger your inhaler, it triangulates the monitors that are close by to you, whether it be a personal monitor, indoor monitor, or the 100 monitors with that in Wayne County. So you have one map that shows, hey, my rescue inhaler was used here in this basketball gym at this school on these days. So you kind of have this asthma diary, but also on that point, what was the pollution, the interlagging pollution that actually drive that usage, right? And I think it's another thing as well, when we talk about building products or data products and having community and people who are proximate to the problem really deliver on those challenges, you understand those nuances, right? I know when I have to use I don't have to use it as much lately. I'm undermanaged, but when I was not undermanaged, is that when you have to use your rescue inhaler, it's so traumatic that you just like don't want to think about that. So as you get that breath back, you're done with it. So this is kind of an automatic way of just tracking that. So when I go to my doctor a month later and they ask me, oh, how many times have you used your rescue inhaler? I'm like, oh, look at it. What's the number say? And then also where? I have no idea. Can't think of it. But having that information just really close the gap in that communication line, especially for diverse populations or underrepresented populations and interacting with your primary care. So that's one behavioral thing I'm really excited about. What can we do to inform behaviors a little bit better? In the environment side, I think to the other point, what we're seeing now being used is informing when events happen. So we had the wildfire events, but we're also seeing large concentration issues and events on certain days within, especially a city like Dearborn, which is in Wayne County. And they're using our platform to inform coaches like, hey, maybe it's not the best time to do the exercise, or maybe take it light today. So that's really exciting. We're not pushing that. People are just telling us that they're using the platform like that, which is super exciting. And then also when you have things to help in the environment, where should we prioritize this little bit of resources on green space, right? It should be data driven. Where should we prioritize electrification of school buses? How about we pick the school that has the most NO2 or black carbon emissions from idling school buses, right? So having this infrastructure can really help us understand how we pick and choose and be the most effective use of those resources that are limited. And then policy change, the last one, I promise, is we're starting to investigate how to enforce things like fugitive dust ordinances or anti-idling ordinances on local streets. So we're using computer vision with a camera and also concentration data and a timestamp, and marrying those two data sets together in real time, so you can see trucks and the concentration data kind of before and post, to then signal to a police officer that, hey, on this days we're seeing a lot of this activity. So police officers not sitting there, they won't sit there and wait for a truck to idle 5 minutes, write a ticket. We've had it in Detroit on the books for 10 years, not one ticket written. So this information is, and I live on, this is insane that that's not happening, but this is actually helping move the operations to help enforce policies. That's to give you an example. Similarly, kind of just give you a kind of looking at a parallel, like you see all these sensors around gunshots. Same thing, like cops are using that to go police. We're using it to go, police or enforce laws that are on the books. And then the very, very last one is around cumulative impact law, which is exciting stuff that Minnesota, Jersey, a lot of folks are coming out to really look at air quality permits, but using our platform and looking at real-time exposure, source truth exposure, to determine what permits and how permits can be written, and not just based on model data, because guess what? Model data always will pass a permit. I'll leave it at that. Yeah. That was a lot.
No, thank you so much. That is, can I hold it? Can I see it? That is so exciting. My mom has severe COPD asthma, and you're absolutely right. The last thing she's thinking about when she can finally breathe is like getting out a journal and writing down like when and where and what were the potential triggers. So thank you for that. The next question is for Matt. We've kind of organically addressed some of these questions, but what are some of the challenges in implementing and maintaining advanced air quality monitoring systems at the regional and national levels?
Yeah, we did get, I'm going to bullet point some of the things we talked about, and then I'm going to go into a different space. One is, I think it's difficult to, the relationship between modeled and ground truth data, the way you maintain those systems are very different. And I think like as the city, sometimes we want like, what, not we, it's easier to have one, this is the true AQI, so we can activate on it. We only have to look at one thing. It makes our systems run easier. It's like an oversimplification. I think there's a lot of problems with it, but I can understand why people feel comforted by saying, okay, this is what the AQI in San Francisco is, and not taking a local bit by bit level approach. I think it's also, it's difficult as a city to maintain a network because a lot of this money is grant funded. It's, there's not scaling staff. I also know that there's worries about, like, right now we have our environmental health branch has, it's understaffed. And so even if we know all of the air quality triggers, it's like, how do we scale up the enforcement? How do we scale the amount of staff we're hiring and all of this other work? But I think the biggest impact is that, and this is for San Francisco, is we have no ventilation in our city. So it's like when you come to what is, people inside their homes are going to be vulnerable during wildfire smoke events. We have, I think, the lowest rate of air conditioning in the country. Our homes were built for a cool coastal climate. People ventilates through the walls. And so, during it's what is the action that we take? And we have limited leverage over private landlords and private development. And I think that this is like the biggest challenge, is the what next piece of it. And rehabs are really long timelines, really expensive, inequitable in their distribution. And so it's, I know that there's a lot of programs to hand out like portable air filtration systems, or to the air conditioners that have a filter. I forget the name of them, but I think it's like, how do you target these resources? Something else I think about a lot, and this comes from the extreme heat world, is we released this map that was like very downscaled. This is what the temperature in these different communities are. When it gets really hot in San Francisco, this is the areas that are the urban heat islands. And what we heard back is from supervisors, from community-based organizations across the board, is like, it might be a little bit cooler in this neighborhood, but I have an older adult who lives alone. They're vulnerable. And sometimes maps even out this, and it's like actually distributed networks of people. So if like a wildfire smoke event, you could say that this neighborhood's more impacted. But if you have someone with asthma or COPD that lives in a house without ventilation, it doesn't matter what neighborhood they're in, they might have an impact. So it's also like, how do you develop an emergency response that manages like the scope of where the problem is? And I think that, and I think a lot of our emergency response is like binary. And then it could be, the next step is neighborhood based. But what if it's like distributed networks? And I think that that's something that we're still like, then the answer is, how do we partner more effectively with clinicians to send out alerts to people with asthma and COPD before events? How do we partner with, which is some of the work we're doing with UCSF? How do we partner with CBOs that know where vulnerable patients are, or in-home supportive services to do wellness checks? And so I think that that is a barrier, is like building that policy on top of it. And that's like a lot of where my mind ends up going. Yeah, I think that's the end of my rant. Thank you.
Add some really quick to that, and I promise I know I'm over holding a lot of space here. I apologize. It's not a super sales pitch right now, but the one thing we learned, that exact thing, and some stuff that we built. We had a Detroit-based monitor and a Dearborn monitor, and if you subscribed to any monitor or you picked a location, you subscribe to all monitors. And we got feedback during the forest fires, and later on, is that, hey, I'm on the east side of Detroit, and I noticed the monitor, when I looked on the alert, is on the southwest side. Why am I getting an alert? And also, like, what's really going on here? So we kind of untangled that, and now we have a network-based approach. So we're the only platform that allows residents to subscribe and pick a monitor or a host of monitors. and you only get alert based on the monitor. So if it's a place of worship, hey, this is where my kid goes to school. It's where I work. That monitor close by here. So I'm subscribed to 3 monitors within the 100. So only when those places of interest increase, and I could pick my threshold too. So folks who are very, very healthy, I only want to get an alert when it's hazardous. But maybe for me, I want to see when it's moderate. And so having that flexibility. But I think the through line and the theme, and I think it's rooted in environmental justice, is giving folks the agency that care about the things that they care about through the information. I think through our design, we got to keep doing that, push those principles.
And the two things that I thought about when you were saying that is, one, I use wildfire smoke events as my through line, but because I don't work on air quality as much. But I think that wildfire smoke events, it's like part of it is it's this big amount of press coverage and like agency, but how do we drive resources to the people that deal with air quality on a day-to-day basis? And I think that that's one of the powers of, silver linings or whatever you're going to call it, of wildfire smoke, is that you can get resources to the people who have been dealing with poor air quality for generations and haven't gotten the appropriate funding. The second thing is, one of the studies I know that CBO did with UCSF was they put air quality sensors inside and outside of buildings, and they measured the wildfire smoke intrusion during wildfire smoke events, so they could understand like the relationship between your housing quality. These were in SROs and single room occupancy hotels in San Francisco. And so they could say like, okay, these buildings during wildfire smoke events, this is the impact, takes longer to air out. And so then we can use that to do emergency response differently, do our outreach differently in those spaces.
Thank you all for your responses. So before we go into our Q&A, I think if we can, each one of you can just give a quick spiel about where you think the future directions are going, potentially within the next 5 or 20 years.
Who knows now? No, but not funny, but but we wouldn't be in this room. We wouldn't take time on Saturday if we didn't really believe in hopeful tomorrow. And I think the hopeful tomorrow is that no matter what zip code, color your skin, what creed, gender, where you are on this planet Earth, that you have the access to the thing that you should be afforded to by birthright, which is clean air. I personally am tired of, I'll keep it real, the Black mothers in our community fighting for environmental justice before I was born. Who knows how bad it would be if they weren't on the front line. I'm tired of seeing children pass away in our community or have severe asthma, missing days of school. So I think the thing we're looking at 5 years, or as fast as we can get there, is to make sure that we honor those voices, honor that work to have an equitable breathing environment for everybody.
That's hard to follow. Yeah. I fully agree with that. So I'll just give my researcher perspective. What's great to be here is to share the stage with folks who are actually using information to do real things in the world. That's inspiring to me. It's an obvious point. Researchers should be partnered with organizations like you all's to make sure the questions we're asking and the data we're generating is useful. One of the exciting things about the AI sort of revolution is that we have lots of opportunities to use data, create data in new ways. I think we really need to harness those opportunities. What I've seen at Stanford, and I can't speak for other universities, is I think often the technology gets out way ahead of its utility. Maybe an obvious point, but one I see every day. And so I think the next 5 years should really be, we don't need to pump the brakes on the AI side, but we need to make sure that we are asking the right questions of our data and making it work for the people who need it most.
Yeah, I guess I think, and this is once again tempered by my own experience in city government in San Francisco, is that climate change can really be like a Trojan horse for good government policy. And there are things that I see happening because the response to climate change is so vast and so interdisciplinary and so cross-sectoral that is really exciting. And it's de-siloing different groups. So I'm a health department, but I'm regularly talking with our Department of Public Works on where street trees should be planted. I'm regularly working with our PUC on stormwater management. I'm regularly working with our emergency response folks. I'm talking to community-based organizations, and we have a climate SF in San Francisco, like a climate coordination body. And I see that as like a lot of the path forward. I was talking to these guys before the panel that we have like a lot of siloed programs in San Francisco that go into people's homes. We have a lead inspection program. We have a asthma remediation program. We have a like senior like drop bars program, and all of them have different funding streams and different inspectors that come in, and they're all in different spaces. And I'm thinking about this from a climate change perspective. That is so far away from climate change, but climate change allows us to broaden what we think about and who we bring into the circle. And so like, that's what I'm going to be hopeful on, is that we can use this as a tool to build our stakeholder networks, to align what we all like agree on. And and that we push forward from there.
Can you all hear me? Okay, perfect. We have a couple of minutes for Q&A. So if anyone has any questions in the live audience, and then we'll check online as well. Yes, sir.
So I suppose rightfully so, a lot of the emphasis has been on particulate matter here, but I'm interested also in GHG concentrations and how much you look at that. And in particular, methane, more than carbon dioxide, and in particular, methane in the home, the rather obvious source of burning, using a gas stove. And I just wondered how much that figures into any of your work.
Yeah, so one of the projects that we're working on right now, and I think it's been led by Contra Costa County, has Michael Kent, who like kind of was one of the first people I heard work on this, is how can you connect people from the health world to the sustainability world? So it's how can you train, for example, home health nurses that deal with asthma to refer their patients to change their electric stovetops? Because there's funding for electric stovetops or for induction stoves or for electrification or a whole host of other things that come through the sustainability world. But then the sustainability programs advertise it to everybody who is attached to that sustainability world, which is different than the people who are in asthma services or in clinics. And so this is a pipeline that we've been trying to build, is better connections between the people who have the greatest health impact of climate change or air pollution exposure to where the resources are coming from. So I haven't like done research on that, but I know that that is something that we've been looking at on as a policy prescription.
Comment quickly on ambient methane. So methane is incredibly potent greenhouse gas. Concentrations of methane in the atmosphere are rising very quickly for reasons we do not fully understand. We do not know where all the sources are. New satellite sensors in the last 2 years have fundamentally transformed our ability to find the sources of this fugitive methane. And so it's found huge plumes, mainly off of natural gas fields, but is providing a technology that is incredibly useful in localizing where this methane is leaking from. And then it turns out it's a very cheap way to remediate. So this is where satellites and AR are really, maybe more than anywhere else, transforming our ability to do something specific on mitigation.
Thank you so much for everything that you've been talking about. And I'm an allergist immunologist at Stanford, and I treat a lot of patients with asthma. And one big thing that can trigger asthma is pollen. And I don't know if any of you saw the recent article in JAMA on thunderstorm asthma events, where we see all this pollen and sensitized people having really, really severe asthma attacks. And I'm hoping that there's some ways to include pollen data in with just air, because pollution, of course, can trigger asthma and COPD, but pollen for those asthmatics who are allergic, even in the inner city, can be a huge trigger. So I think just to add to that would be a really helpful thing for asthmatics.
I think one thing that's kind of through line with both your comments is speciation, knowing like particulate matter could be from asphalt or wood chip or some black carbon or something that's going on. To be able to capture what is that matter that's in the air. I think also for methane, I think also satellite is probably actually I would say like biggest bang for our buck right now. Sensors, this because of speciation, we can look at total VOCs, but how many VOCs are like 93, something kind of insane. So we can say that, hey, we have a monitor on me right now that can detect VOCs, but what is that VOC? So we have to understand the sources to be able to predict where those VOCs and the behavior. And some of these gases do have different behaviors on how they travel. Can be predictable, but the speciation thing, I think, also might be one of the things in 5 years where we can say this particular matter is coming from through the forest fires. This particular matter is not actually the forest fires; is actually coming from these trucks that are idling on the blocks during the same time. We don't have that ability in real time as much yet, but we'll get there.
Kelly, how are we doing with the online folks? Any questions from online?
Yeah, there's one question for you.
Okay, I'll go ahead and pass this.
Behind you too. Got one over here if you.
Oh, I'm sorry. We just want to make sure we give our online audience a chance to chime in. So we'll get to you, sir. I promise.
And Anthony from online asked, what opportunities are there for the community to have a hand in collecting and analyzing the AIR data and the co-development of any reports and or cumulative impact assessments, if any?
I think great question. Good, Ali. I think that the community should be leading that. Community science is a real thing. That's something that we do. We try to pull back as much inference and explanation of data when we do our workshops. So when we do our workshops, to answer your question directly, for example, we have a 6-month workshop here with some of our projects, and we show the data, we show averages, we show things, but we let the community talk about their experiences around the information. You hear some interesting things. You hear folks really taking power, agency over the information. We've heard testimonials really touched my heart that the data that they saw through the network actually mitigate their. They said, "Hey, I stopped smoking indoors because now I understand how air quality can be affecting my kids." Like simple things like that. Or a brother said, "Hey, I am telling parents to stop idling when I pick up my child because why are we pumping NO2 into our schools?" So I think it's really powerful that community should be leading the efforts from deployment all the way to data analysis and making sure folks have those resources. People are interested in it. It really impacts them, but also gives a real engaged citizens who can advocate for the policies, can advocate for the things that we need for intervention for them. So I think it's really, really powerful thing we should keep doing.
I got one over here. So I heard, I think, gentlemen from San Francisco talk about text alerts and that sort of thing, which is good. Do any of you have examples of taking heat or wildfire data in an immediate sense and plugging it into Epic or other clinician tools so that when a clinician sees a patient or is in touch with a patient, that they can be using some of this information directly?
This is absolutely something that we're want to work on. This is exactly it, is that we view clinicians as the first point of contact. I see a hand raised here, so you might have more to say about it than I do. But this is, we have a lot of clinicians that want to do touch points with their community, with their vulnerable patients. One of the things that we've also worked on is the National Weather Service says it's a heat alert. You're going to have a heat alert in 4 days. You're going to have extreme heat. And we get that information because we have a watch center in San Francisco, and we need to do a better job communicating it to clinicians so they could take immediate emergency response action on that. And I think that's an onus on both sides, is because we push out that messaging, but we don't target it to clinicians. And then I think we have a project right now with UCSF where we're working on how to take that and then translate it into clinician-facing materials. So absolutely, I think the goal would be to have an Epic screen that comes up that says, heat events coming, this person has diabetes, make sure they have their medicine ready, make sure they know these are going to be their impacts and how to take precaution.
Yeah, great panel. I am Titus Schleier from the Regenschiff Institute. I wanted to ask about data standards. We've covered a huge landscape of data. If we think about a word cloud that enumerates all the data pots we've talked about, it's a huge cloud, and in order to use data, we first need to understand what is in the data set. What are the variables? What are the valid values for the variables? What are the not variables? What is the spatial resolution? What is the temporal resolution? So you get all these, just for one data set, get a huge set of metadata to describe it. And now we're talking about integrating all of them. Volatile organic compounds, methane, pollen, and so on. So I'm interested in how, as an informatics community, do we address this issue of being able to put these data together in meaningful ways so we can draw conclusions that help us.
Yeah, we have a self-proclaimed standard. Well, it's standard as in we normalize data in our form through temporal and spatial, latitude, longitude, time, resolution for all instruments. So some instruments may have hourly averages, some instruments 5 minute, 10 minute, et cetera. So trying to get as granular as possible, trying to repeat that. I think a bigger part, at least we're talking about air quality data validation, is that there's a thing called quality assurance project plans that are QAPs that are my bane of existence, but that's why we built Just Air to automatically do those things. So when you see ozone positively correlate with NO2, that should raise a flag, right? Because the chemistry doesn't really make sense. So how we look at automating data validity. So there's one thing to do standardization, but two, also validate the information that we're seeing so that when we are making decisions that it's coming from a source of truth. So we're playing in that part. I think it's a wild, wild west, to be honest with you. So I think a big opportunity for us, we'll love for you all to give us advice. And anyone who has experience, one, I got to do a plug, is anyone around how we can use this air quality data to plug into Epic or Inform. I would love that. Two, how do we actually look at other health informatics and bring that data in? Love advice from this community on that.
Kelly, do we have any other questions online or? Okay, I'll bring the mic over.
Preet from online asks, how would this data collection be in relation to syndromic surveillance that is currently beginning with CalSys?
I would like, could you repeat the question? How would it?
How would this data collection be in relation to syndromic surveillance that is currently beginning with CalSys?
Oh yeah, so I think that we want to create a relationship, of course, between exposure and health outcomes, right? And so the more health outcomes data, surveillance data that we get in real time, we could identify like triggers to that, and then we can respond. We can prepare. The goal is to not have, to drive down surge. The way you drive down surge is by understanding what leads to that surge and then addressing that in the first place. So like when it comes to heat, how do we make a relationship between outdoor temperature and 911 calls? And so we can see as temperatures go up, we can understand what's going to be driving those 911 calls. And I think the same comes with as much as we can get downscaled like air quality data, we can relate that with triggers. So these are the areas where people are using their inhaler. So these are the areas where we're seeing, we can then focus our interventions on those spaces. I think they go hand in hand.
There are a few questions online. Next one is from a Mary Jacqueline that asks, what about considering that if a patient scores poorly on the social determinants of health, that they likely are being exposed to climate change health disparities, and incorporating environmental determinants of health during patient contact? Overall, this is for the healthcare community in general. So if anyone else has thoughts.
Yeah, anyone in the healthcare community want to take a stab at that question? I mean, we can keep this open.
I am not from the healthcare community. I want to answer this question. Hi, my name is Satish. I am not from the healthcare community. I am but I still want to answer that question because came to this not exact same thing, but around the thing many, many times. See, the one thing is CDC has published a social vulnerability index. That is a combination of 16 parameters, and that is zip code wise. So you can pretty much able to get the equity side, not exactly because people in the same zip code or same locations might have a different social profiles. Second is environmental impact. So they also come with a heat tracker that you can see the 7-day heat projection, and also a zip code wise. So if you take these two data sets and combine those two data sets, so we will know that in this zip code, what the profile is going to look like. So that is number one. Number two, that you can get from the census data demographics that how many people of which race, which age group are there. So on the broader scale, you know that people above 65 or people in the band of 70 to 75 are going to be much more vulnerable. Then National Climate Assessment Survey, these four data points. Now I come to the third question that, and all the other questions that, how to intimate that if the temperature goes to 110, who are the people who are going to be most impacted? And who are going to land into clinics and who are going to land into emergency rooms? So that requires that either public health, and of course, they have a fire connections to these days of syndromic surveillance and every kind of thing. So they have to create a ICD code tagged patient registries. That these are, and that is a groundwork. If this groundwork is not there, it cannot be done. Then you have a projection that this person, like me, have 5 underlying health conditions. And if the temperature goes like 110 degrees Fahrenheit, I am potentially land into emergency room. And my residence address is this, my work address is this, so I can land from any of these two places. So these are the hospitals where probably I am going to land up. Or this is the primary care physician where I am going to land up. So these data sets, on top of these data sets, only this can be delivered. Thank you very much.
I think we got time for 1 or 2 more questions. All right.
We need to make that happen tomorrow. Like,
Hi there. No, I just wanted to also respond to that, just to say that at UCSF, UCSD, and UC Berkeley, we recently are starting an NIH-funded climate and health center that is actually focusing on this very topic, which is the intersection between climate change, the social determinants of health, like material need insecurities and the built environment, and health, and how we can use data to intervene and model, on those factors to improve health by intervening on those social determinants of health. So stay tuned. There'll be webinars, seminars, and all sorts of things that will be relevant to those topics, and some seed grants as well.
Hi, my name is Annie, and Dr. Sherry Weiser was my attending professor and advisor at UCSF. I'm a practicing clinician at Santa Clara County, the public system, hospital system down there. And this is an exciting time for researchers and clinician because I'm not sure if people are aware, but California had a waiver to innovate in Medi-Cal, and there are 14 community supports. Asthma prevention is one. Healthy food access is one among 14. So when we talk about data intervention, we really have to look at the communities that, people are clustered, right? Like where are the most vulnerable communities, neighborhoods, and also where are the organizations located? There are community organizations in these neighborhoods that know these communities best. What work are they already doing on the ground, and what partnerships can we build to really, like you said, really make this like a citizen, community-driven data process collection, making sure they understand the data, making sure that they have an ability to interpret and advocate for change, because a lot of the change will be local, and the adaptation will be local.
Yeah, I think we've got time for 1 more comment, so go ahead.
I just wanted to add, today I've heard a lot, we have to go back to the community-based organizations because they know the communities best, train them on the data. So I just want to put a plug in for the community-based organizations because these organizations are working really hard. They work on a lot of grants. So we have to figure out financial ways that they are sustainable and they're not just working on grants.
All right.
Thank you for saying.
Hi, I'm someone coming from the community. I had one question. I don't know if anyone can hear me.
Oh. Right. Whoa. Go ahead. Go ahead.
Hi, my name's Jessie Liu. I'm a primary care physician at La Clínica de la Raza. that works in East Bay, specifically in Alameda, Contra Costa, and Vallejo, so Solano counties. And everything here, I am just extremely excited by working with our Climate and Health Working Group. We send text messages out to thousands of patients who at higher risk medical conditions during high AQIs and heat. But we are a very small group of people. I agreed with what everyone has said about being resource constrained. And I'm curious to hear from Just Air and the SF Department of Public Health. What are some of the ways in which you've been successful in working with, I think, administrations of community organizations who are oftentimes very focused on just putting fires out and keeping current operations running, to help build collaborations around things like environmental justice and climate work that they may not be focused on currently?
I'm just going to start by saying thank you so much for that question. I think that is the biggest gap in the work that we're doing right now is we make a lot of lip service to our CBOs and say, you guys are the front lines, we need to depend on them. But then there's a huge amount of administrative barriers, bureaucratic barriers, cultural barriers for us actually funding you to do that work. And I think that we right now have worked closest with our CBOs and with the people sending out text alerts by providing like, you know, as much data as we can, as much like scripts or whatever else we can. We need to do better at providing like, these are the cool spaces or the ventilated spaces. So you can send folks to those spaces if you're, you know, discharging them to an unsafe home. But I think this is like the number one thing we need to work on is how to properly fund folks that are doing this work to continue doing it because, yeah.
Yeah, I'll just double down on that. Things that we've seen, and we're able to execute this on a couple of projects, and it's something I would love to continue to do. I think in three pillars. One, 100% the funding upfront, being very transparent. Many EJ organizations, maybe ran by 2 people, may not have health insurance. I'm not meaning to paint that picture in a kind of dark light. These are amazing folks, some of those brilliant people in our community who are leading the charge, handling everything from food, jobs, and an environment. So I think being transparent up front as institutions, you all can apply and get dollars a lot faster and have the infrastructure to handle those dollars and making sure that we can provide that operational bandwidth from a financial standpoint. That's 1. 2, being transparent throughout the whole process. This is how much we're getting, how much y'all are getting. Is this okay? And have those negotiations and MOUs up front. When the project begins, we found any opportunity we can to support funding for things that people do volunteer-wise. And it sucks that communities that are suffering are having to do the work on the ground. So anytime we're doing tabling, we pay hourly. We have a program where we're teaching people how to put up monitors. So economic development for returning citizens and people who are coming up out of high school, understand STEM and do some dignifying work. So we kind of do that process, paid $35 an hour. And then the last one, and this is a thing, something I miss, is making sure when we do our workshops in community, workshops are good opportunities to add that layer of infrastructure, to provide the food, provide the space, provide the translator, provide daycare, childcare, make sure it's done after 5:30 when people get home. And then also one thing that we found works really well is the power dynamic. When people walk in, we use a process that's put in a sticker. People from that community, make sure the first to speak and last to speak in any table conversation, and trying to drop as many doctors and off the name tags or in the intros as possible. We are as people. So all I to say, money up front, transparent. Anytime in the process, we're ask people to volunteer, pay them, and then the power dynamics and make sure it's accessible throughout the project.
Could I
That's very helpful. Thank you.
Yeah, just the last comment, and then we got to wrap this session up. So
because I'm just gonna like the thought process I've been going through, which is part of that question, is when we get into the conversation of how do you create like a patient profile very specifically that says that this person is more likely to be vulnerable during heat. My mind immediately goes to, because I'm on the city importation side, okay, how do we reach out to that person? Like we need to scale our text messages or our wellness checks program. And that takes like money and people and resources. So the information side, I think in a lot of ways is easier. Like it's how do we get like, the next step is how do we fund the people that are actually doing the phone calls And I think that's where I see the big gap is not in the what do we know, it's how do we affect change.
Excellent. So with that, we're going to go ahead and wrap up session 1. Thank you all so much. We'll go ahead and advance to session 2, advancing health equity through data-driven solutions for heat impact mitigation in California and Arizona. So I'll go ahead and give a brief introduction to the session. As extreme heat events become more frequent and severe, understanding and mitigating their impacts on vulnerable communities is critical. This session focuses on leveraging scientific and health data to identify risk drivers for heat impacts, with a special emphasis on health equity. Participants will gain insights into the value of multidisciplinary collaboration and the development of innovative technological solutions to address heat-related disasters. Through a combination of expert presentations, case studies, and interactive discussions, attendees will learn how to create and implement a data-driven extreme heat ranking system that integrates diverse data sets and provides actionable insights to mitigate heat impacts equitably. So I'll go ahead and introduce our panel. So we have Dr. Teresa Cullen. Go ahead and wave. She's a family medicine physician and clinical informaticist, and she's also public health director for Pima County, Arizona, and she's an affiliate research scientist at the Regent Street Institute. Next, we have Enrique Huerta. Go ahead and wave. He is the legislative director at Climate Resolve, which is an organization that builds collaborations to champion equitable climate solutions, connecting communities, organizations, and policymakers to address a global problem with local action. They've developed practical initiatives that reduce climate pollution and prepare for climate impacts. Monse Consol, go ahead and wave. Yep. She's the project manager for heat resilience at Google, who has spearheaded Google's new innovative tool using satellite-based high-resolution land surface temperature data, employing machine learning algorithms to identify buildings, trees, and other factors critical to determining how much heat a portion of land absorbs. And she's done some great work at Google. And last but not least, Walker Whelan. He is the environmental program manager at the Office of Environmental Health Hazard Assessment, otherwise known as OEHA. And he is the lead for Cal Heat Score, which is a tool that increases awareness of local and regional extreme heat events by translating weather information into easy to understand health warnings. And I wanted to go ahead and introduce our student moderators. Kelly Landucci, go ahead and wave. Yep. She's a second-year genetic counseling student at UCSF who has been an instrumental part of organizing today's event. So thank you. And Anjali, you can go ahead and just pronounce her last name. I'm sorry. Perfect. She's a first-year medical student at Stanford. She's originally from Cleveland, Ohio, and she previously conducted environmental health research with Dr. Gordon at the Cleveland Clinic. So I'm really glad to have you guys moderating, and I'll let you guys get to it.
All right, so hello. Yeah, it's on. Okay. So thank you so much for joining us here today. So to start off, I just thought it would be really great if you all could just describe, what originally sparked your interest in climate and heat and how you entered the space and what you are currently doing in this space now.
All right, I'm realizing I'm first in line. Probably shouldn't have sat here today. Yeah, that's presentation. So what sparked my interest in climate and heat and what are we doing now? Yeah, okay. So everybody, happy to be here. Walker Whelan with OEHA, part of California EPA. Super excited to be in this conversation with you all. So I'm a newbie in this space. I'm pretty new. I've only been working in the sort of climate and heat specifically for less than a year. Why did I get called up to this table? Well, I used to work on a tool for the past 14 years called Cal EnviroScreen. And so that is a environmental justice screening tool for California. It looks at cumulative impacts based on a number of factors. And most importantly, it's tied to funding, big spending decisions throughout California. So my work on that prepared me for this really exciting new initiative in California. The passage of Assembly Bill 2238 in 2022 mandated the creation of extreme heat ranking system for the state. So basically, the idea here is that we have tornado and hurricane ranking systems to communicate risk, the magnitude and sort of intensity and severity of a risk. Why not for heat? It's because heat doesn't make the news as much as hurricanes and tornadoes. And we don't have a full sense of who is getting sick, where they're getting sick, how many people are actually dying from extreme heat. These numbers are vastly undercounted. So the idea here is that we're using really microclimate, local climatological data. We're using weather forecast data to give us a sense of, how uncharacteristically hot is it at any given point in California on any given day. And then, a lot of weather apps do that. That's not really the unique part. The unique part of what we're trying to do is pulling in emergency department data and getting a sense of how many people are getting sick historically in these different areas or dying related to extreme heat, because we know that there's different sensitivity levels and so on and so forth of how many people are getting sick where. So the output of what we're working on for Cal Heat Score is essentially these predictive models that give you a sense of, okay, well, here's how hot it is above baseline in my community. Here is the associated risks, how the likelihood of people in my community getting sick from extreme heat. It's not only going to be that, though. What we're also working on is tying that to locally available resources. Where are the nearby cooling centers that you can get mapped to, get directions to? Maybe cooling center data isn't as relevant. Maybe you want other sort of data in your community. So that's sort of a segue into a real key part of Cal Heat Score. What we're working on is building it with a community-driven approach. And so actually asking community members, local government representatives, local health departments, what sort of information associated with the extreme heat ranking system is going to be most relevant and most helpful for you. Don't Google Cal Heat Score map because it doesn't exist yet. It's coming out January 1st, legislatively mandated. So we're working on, well, maybe we can clap on January 2nd once it's out. No, super excited. Have a great team working on it. A lot of momentum behind it, and that really kicks off the beginning of our engagement, our user testing, and our feedback process. It's a tool that will iteratively improve over time, and eventually be tied to various decisions throughout the state related to funding and other work. Thanks.
Hi, everyone. I'm Mansi. I'm a product manager at Google Research. I accidentally got into this space, and I'm so grateful that I did accidentally get into this space. So I was a product manager in Google Maps, working on, improving Google Maps and features, and in my happy little world. And then COVID happened, and overnight we had a number of teams at Google that were thinking about, okay, so what can we do about COVID? And I ended up volunteering for a team that used mobility data, and we anonymized and aggregated that mobility data to create COVID or community mobility reports, which were basically reports which were looking at what the people's movements were during the early shelter in, when the only solution available was shelter in place. And from the day we came up with the idea to the day we launched, I think we launched within 3 weeks of figuring out that this is something that could be useful. And governments across the world, public health departments across the world were using our reports to say, are shelter-in-place policies working? Where are, how should we think about our immediate response? And it was just so powerful to know that I can be at a place that, like Google, use the power of the data that Google has, access to the data that Google has and the technology, and do that for good. It was just so powerful. And immediately after that project ended, I officially moved to that team. And I've been really lucky to be part of the team at Google. Within Google Research, we have a group that works on using AI and technology for social impact, for climate, for health. And so that's the area that I've been working on. So we worked on a number of products that looked at, how can we use the power of Google search data, maps data, satellite data. Google has tons and tons of really high resolution imagery for our maps that you see on Google Maps. That how can we use that for public good? So in terms of, after we worked on a number of projects around COVID, and then we were thinking about, okay, what is the biggest threat to public health? Climate change is the biggest threat to public health. Extreme heat is the silent killer. What can we do about it? And so I've been spending the last 2 or 3 years working on solutions that can help both mitigate extreme heat, as well as thinking about solutions where can we meet people, what are the ways Google products can be helpful in people's day-to-day journeys as they experience heat. And then I've also been working on other areas with climate, AI, methane. I think the previous panel talked about methane and how the power of satellites and AI is really revolutionizing that. And so we have a team in Tel Aviv that's researching and working on better methane leak detection from oil and gas sources. Our hope is that we can, we can use the power of technology both for climate adaptation and mitigation. I feel really grateful to be here and to be part of this community.
First off, thanks for having me. I'm Terry Cullen, family medicine doc. I would say I got into climate accidentally, but it was a long time ago. I'm a retired public health service officer. I spent 25 years working with American Indian Alaska Native tribes. The Thilnatham Reservation, and I'm in southern Arizona. If you've heard of the border, I'm the border. The longest contiguous border is me, which actually has a real intersection with heat because of undocumented border crossers and the tremendous amount of death we see. But I worked on the Thilnatham Reservation, and there's a community called Big Fields. And it was called Big Fields because there were big fields there, and it was irrigated through monsoons. And it was literally mounds of seeds placed, and the monsoons would come and irrigate, and there would be crops. And Big Fields right now is a desolate southwestern desert because of what's happened with heat and with drought. And at least in the Southwest, we can't separate those two. However, I then did informatics, and I see Jesse and some people I know, and then I stopped informatics. I was over informatics, and I became a public health director about 5 years ago. And I realized I had to do informatics again. So, so I could never escape it. And it's because of data. So we actually at our health department, we're lucky enough, we have some BRACE funding. We have funding from others. We work really closely with our community, and heat is not an emergency. Heat is a way of life. And I think that gives us opportunity as well as gives me a lot of pessimism. But the opportunity is that it is easy to get 40, 50 community-based organizations in the same room because we know that our heat response is not a tornado, it's not a hurricane. Heat season used to be May 1st to October 1st. We've just changed it from April 15th to the end of October because in October we were still having heat-related deaths right now. So we stood up climate and environmental health justice. I would tell you those words, health justice, are trigger words. I expect them to we see more trigger with them, but we've been able to use that and parlay it into a really amazing program and response to heat that is based on equity and justice. We don't do anything without looking at what are the social vulnerability indexes, the COVID vulnerability indexes, the mobile home index, the tree canopy index, lots and lots of stuff out there, to make sure that what we're doing is going to help protect the most vulnerable and yet give everybody in the community a seat at the table. The one beauty about heat, beauty and negativity, it affects everybody. It's not just people that are unhoused, it's people that live in the foothills or in wealthier areas. So it's somewhat may give us the opportunity to work in places we haven't been able to do.
Hello? 1, 2, 1, 2. Hi, everybody. Enrique Huerta, Legislative Director. That's code for lobbyists in Sacramento. At Climate Resolve, we're a Los Angeles-based nonprofit organization that is trying to shift the conversation around climate change from polar bears and trees to people, how climate change is affecting people, and making sure that we secure the resources, the policies, and the data to uphold that mission. How I got started in environmentalism. I'm the son of a contractor, and I had a front row seat when my dad would build these beautiful homes. But I also had to really bad seat when it came to all the waste that was generated. Architecture is one of the most wasteful industries in this nation, accounting for just an exorbitant amount of greenhouse gases, terrible carbon footprint. So growing up, I was around construction all the time. I thought, why don't I go to college and study architecture? So, I took all these drafting courses in high school, and I tried to complete the A through E college requirements. And when I applied to college, lo and behold, they told me, hey, your grades are deplorable and your drawing really, really sucks. So plan B, I became an urban planner, worked as a city planner for about 10 years, worked in the city where I grew up, and realized that, hey, the same environmental problems that were here 10 years ago are getting worse. And so I said, why don't I take a shot at architecture again? But this time, let me do landscape architecture and, shape nature-based solutions. Wash, rinse, and repeat. My drawing still sucked. So luckily, I was referred to the Regenerative Studies program at Cal Poly Pomona, interdisciplinary program that tries to address everything from the way we live to the waste that we generate and come up with a feedback loop that minimizes greenhouse gases, the emission of greenhouse gases. I became a community organizer in Watts and Cudahy in Southeast LA, taking vacant lots and turning them into parks and gardens. A lot of that work was women-led from people in the community. These were women that were not employed, yet were caregivers to multiple generations in their households, including their neighbors. And I quickly found out that not only did they have it on the knowledge, but they were some of the most vulnerable people to things like extreme heat, which affects those communities. So I met the executive director at Climate Resolve, Jonathan Parfrey. Doing that work, he asked if I wanted to take those community organizing skills up to Sacramento to do some door knocking, to shape policy around extreme heat that's people-centered. And I said yes. And the rest, as I say, is history. Pleasure to be here.
So beautiful to hear the wide range of experiences and expertise that you all bring to this panel. Thank you so much for being here. Our first question is for everybody. And it was touched on a little bit in some of the introductions, but if you wouldn't mind diving a bit deeper into how climate change is affecting the frequency and intensity of heat waves, and what are the projections for future heat events in different regions? Who is most impacted and why?
Should have sat down there. I think I mentioned that before. I'm not a climatologist, so I'm not going to talk about sort of interactions of the molecular interactions in the air for how that's changing heat events. I think I'm going to pass that to somebody else. But one thing that we're really focused on at our office is working with our partners at the Department of Public Health. They're doing a lot of great work doing these sort of evaluations and analyses of hospitalization data, of mortality data, and giving you a sense of not only do we have from this sort of weather and climate side this increased duration, but we have also a sense increased frequency and duration of climate events. We also have a sense of how many more people are getting sick and where they're getting sick and where things are actually getting worse. So, there's a lot of interesting research that's been going on for a long time about urban heat island effect. I think everyone has a clear sense of like what that is. But I don't think a lot of folks have a sense of some of the costs that are associated with extreme heat exposures. So I wanted to call out this great work that some of our other partners at the Department of Insurance just did on, they looked at over the past 10 years, basically, or 10 or 15 years, the 10 biggest heat waves, biggest heat events in California. And then what they did was they did this analysis that looked at all of the costs across different sectors, insurance related costs associated with extreme heat. The reason why I'm talking about this is because it's less about it's getting hotter and more people are getting sick, but it's actually putting dollar signs behind it and making it more tangible to people who are understanding in different sectors, like the public health sector, what extreme heat impacts are having. So the analysis, it looked at these 10 different events. It evaluated not only the costs of more and more people getting sick and going to the hospital, but it also looked at the costs to agriculture. It looked at the cost to increased number of cows dying in the Central Valley. It looked at infrastructure related costs too. So I just wanted to call that out as like, there's a lot of different ways to talk about how extreme heat is affecting us. It can be from sort of a health perspective, but it also can very much be from an economic and insurance related perspective, which in some ways that I can talk about a little bit in the future or later on in the session, allows us to engage different sectors in the space.
Just to maybe call out I think most of us have seen the numbers, right? The number of heat waves are increasing, the duration of heat waves are increasing. 2023 was the hottest year. This week, 2024 is now the hottest year on record. The first year we are breaching the 1.5 degree C mark. The UN Secretary General came up with the call for extreme heat. There is an increased notion that not only is heat duration increasing, but the intensity increasing, but it's no longer, it's no longer questionable that this is something that is happening. The other statistic that is mind-boggling is that cities around the world are heating at twice the global rate. And with increased urbanization, when you look across the world, there are some projections that about I'm sure I'm going to mix up the numbers, but more than I forget the number of people that are impacted by extreme heat today, but by 2050, as many as 3.5 billion people, as more and more people move to cities and the cities grow hotter because of the urban heat island effect, as many as 3.5 billion people will be affected by extreme heat. And so not only do we need the extreme heat response, the emergency response, we also need actions to mitigate that extreme heat. There's an increasing concern about the cooling needs for people and the GHG emissions because of the cooling emissions. It's not just, it's not just the public health threat, it's not just an economic threat, it's also this vicious cycle of more air conditioning and more GHG and this without action that things will not get better.
Yeah, I think what we're definitely seeing if we look at the clinical data is HRIs, heat-related illnesses, which are tracked at anybody that's dealing with heat in a community is tracking their HRIs basically in near real time. It's ED data that's being transferred into mostly the health departments. It's then correlated with what NWS is saying and what's going on with the heat wave, and then it's correlated with the death outcome. Obviously, public health is trying to decrease morbidity and mortality. I think, however, as we see the number increase, what we're also seeing is the lower temperatures increase, and people I'm sure are aware that at the time that the lower temperature is not lower than your body temperature. So if it's 98 out there, there were multiple days in Phoenix this year where you're at probably 96, 97. That's the date, that's the nighttime lowest temperature in Phoenix. We were a little lower than that. The real concern then is a physiological concern about what happens to your body, especially if you're in a situation, to go back to equity and justice, where there's not cooling available, or you are unhoused, or you have lots of other things going on. I also think we have to think globally, and what we're seeing is increasing drought and heat, especially in sub-Saharan Africa, affecting the food supply, affecting nutrition, and obviously at some point will be affecting climate, will result in climate asylum seekers.
So that's just it. Climate change is increasing the propensity for these really out of control heat waves, ones that are longer in duration, that are hotter, and that happen more often. I mean, who would have thought that in the year 2022, the Northwest would have experienced a 14-day heat dome where the prior temperature record was 107 degrees back in 1932, and the temperature, the temperature that was shattered in 2022 was 121 degrees, and it was 30 miles from the Bay of Vancouver. So we don't have to go that far to realize that the people that are being affected are typically people who live in communities that have been historically disinvested, neighborhoods with no trees that are overly exposed to sunshine, neighborhoods with pre-existing medical conditions as a result of living in these communities for so long, hypertension, asthma, diabetes. On top of all of that, when folks end up in the emergency room, they're the least able to bounce back from a hefty emergency room bill. That's happening more and more. According to the California Department of Public Health, by the year 2050, if we do not mitigate the amount of greenhouse gases that are in the atmosphere, we're looking at 7,000 to 11,000 more deaths per year. Granted, the LA Times last year came out with an article citing the historical undercount that California has held around extreme heat mortality, and they actually put the number 6 times worse. So this is what's making our work a lot more urgent. This is how climate change is affecting the frequency, duration, and intensity of heat waves, and that's who it's affecting the most.
Thank you so much for sharing that. I think those numbers are really scary and staggering, but help place this issue into context. So this next question is directed towards Dr. Cullen. I know you touched a little bit on HRIs and heat-related illnesses, but could you expand a little bit more about what the most significant health risks are associated with extreme heat, and what populations are most vulnerable to that?
Yeah, so let's start populations first. I think you've heard some of it: diabetes, hypertension, the aged, the really young, pregnant women, people that may have underlying other diseases like chronic kidney disease, chronic dehydration. These are all factors that put you at much higher risk to have a serious sequelae if you get a heat-related illness. We also know that everybody has a different basal body temperature. You probably know that. You go to the doc and they said, "Oh, you're only 96," and you're going, "No, that's a fever for me. I should be 94." Anyway, so this whole concept of what's a basal body temperature is important. And the reason why that's really important is, and we talked about that last session about that EPIC or Cerner, whoever doing the query, we've been working a lot on what is your personal health risk score. Are you taking medications that put you at risk? Have you had a previous injury related to heat? Do you have a chronic kidney disease situation where you're not on dialysis, but you've had your kidneys impacted? So all of this is generic, but also then it becomes personal. And I think that that's really important. That's why we know that some unhoused people are fine outside and other people are not outside. So, but what do you normally die from? It's a horrible question, but most people are dying from cardiac disease when they're overheated. Lots of reasons for that. You may recall, if you get overheated, you go run, you're overheated, your heart rate goes up, your inability to sweat decreases. You get yourself in a physiological situation where you can get in real trouble. Respiratory disease happens more often. We work really closely with our EMS responders in Pima County and the city of Tucson. We actually get their data on a near real-time basis too, so we can figure out what's going on in a small area to really make it micro local, which is what we found we really need to do. But overall, you just overwhelm your body. The other thing that happens for us, and it may happen, probably not in San Francisco, because I always think it's freezing here, but in other places where it's warm, people who have lived there their whole life think they're fine. They can go hike for 3 hours. They're going to be fine. Nothing bad's going to happen to them. And so when you look at who dies, at least in Pima County, and you take out the unhoused population, the vast majority of people that are dying are people that have lived there their whole lives. And because there's this sense, not that you're super, but that you've acclimated. And the one other people that are really at risk are people that work outside. And we've done a lot of work with our businesses to make sure that they have in place ways to protect their employees. I think California does a much better job of this than Arizona does.
A couple of quick thoughts. Yeah, so California just passed an indoor heat standard recently. I want to say it's about 86 degrees. I feel like that's the number. Interestingly, so that law got pushed through, and it almost didn't succeed. And then it passed with a slight provision that the prison industry was not subject to that indoor rule. So just a quick note on that. Yeah, looking at the health data, you were talking about the health data and cardiovascular disease. It's really tricky to sometimes investigate the health data and try to get a sense of, especially in chronic cases and chronic conditions, what chronic conditions are tied to extreme heat. So if you're looking at respiratory disease, well, respiratory disease is highest in the winter. That's not helpful when you're trying to aggregate all of this data and get a sense of how it correlates with extreme heat. So those are some interesting challenges and questions that our research team is working through too.
Yeah, and let me follow up. Where's Titus? Titus asked the question on data standards. Very, very important in this place. Our Office of Medical Examiner does not trust any of our data before 23 because the issue is what is heat related, what is heat caused, and what is heat associated. So the American College of Pathologists have been working on this to determine it. But in many, many situations, everything just gets lumped as heat without having a forensic evaluation of what happened with that individual and what the cause of it was. So it kind of points out what you're saying, that the data, even the number of deaths, the 6 times number of deaths that may be real, it's difficult to get that from vital statistic data.
Thank you, Dr. Cullen and Walker, for providing those crucial and difficult points, but important. This next question is for Enrique, and we'd love to hear more on what strategies and technologies show the most promise from mitigating urban heat island effects and protecting communities during heat waves.
So one of the other things that we've been trying to elevate at the state level, and these are emanating from lessons we've learned doing community organizing, is the need to move away from siloed solutions, meaning a solution that addresses one issue at a time, and doing more of a comprehensive, holistic, and integrated approach to community cooling. That said, we advocated for the update to the Extreme Heat Action Plan in 2022. And in that plan, there are over 80 different tracks and strategies that communities can take to cool not just their communities, but their homes. Some of those strategies involve simple things like planting more trees in the public right-of-way on your street, having covered bus shelters so that when folks are traveling to work, they're not being hurt. Having more, shade structures in the public right-of-way, that could help. And then there's some really neat solutions from overseas, like thermal chimneys. These are chimney-like designs that extend 40 feet into the air. And if you were to go under them, there's like a 30 to 40 degree reduction in ambient temperature. And it's all because of the physics of wind and air, and I can't get into any of those details. But you're creating these microclimates that are safe for people. There's also cool roofs, cool walls, and cool pavements. And this is a strategy that more and more is showing that there's mutually beneficial benefits. I just repeated myself. Sorry about that. But the idea with cool surfaces is not only are you able to cool the ambient environment for people on the ground, but because, and we're going to talk a little bit about physics here, but because you're taking infrared radiation, that's energy that's not visible to the eye. You're taking long wave radiation that's coming through the atmosphere, and it's hitting this cool surface, and the cool surface is bouncing back about 30% of that energy back into the atmosphere. But guess what? It's not being absorbed and reflected by carbon dioxide because it hasn't turned into heat. Carbon dioxide and heat love each other. Long wave radiation, not so much. So it's able to bypass carbon dioxide in the air and go straight back into space, just like a glacier does in nature, except glaciers are reflecting visible light. We're talking about technologies that's reflecting infrared, invisible light, energy. Those are some of the solutions in the Extreme Heat Action Plan. And I know that there was a second part to that question. If you don't mind repeating that, please.
And specifically discussing protecting our communities during heat waves.
Okay, I think this is an issue of funding. So when we advocated for the update to the Extreme Heat Action Plan in 2022, it was during the budget surplus years of California where they had hundreds of billions of dollars of money that they didn't know what to do with. So we went up and talked to a bunch of agencies, talked to legislators, talked to the governor, and we laid out the plan. Here's the action plan. Give us $500 million to implement it. He kind of laughed and said, I'll give you 175. So we got 175 million for the action plan. We got an additional $300 million that remained nebulous for about a year, some of which the Cal Heat score was a result of. So was a syndromic surveillance system and a few other programs that are looking to cool communities. So our position from Climate Resolve is not to just deal with the built environment, but also we need to establish measures, gauges, standards that we could hold, that we could look to guide some of these healthy outcomes that we're looking for. Walker mentioned the indoor worker heat illness prevention standard. We partnered with labor and workforce protection agencies about 3 years ago, trying to get Cal OSHA, the Division of Industrial Relations, to restart the rural procurement process that was mandated in 2016 by law, that a standard be in place by 2019, January 2019. We started talking to our friends at the Warehouse Resource Worker Protection Center, WorkSafe, SEIU, Teamsters in 2022, and no standard had been put in place. So we organized, we attended every single meeting from 2022 until July 23rd of 2024, and we're on the mic advocating for workers, for the protection of workers from rising heat. We're proud as a climate justice organization to have lent that climate change perspective to labor, who has traditionally been focusing on worker protections, but not really making the link to climate change. So that was a really, really cool initiative that we were a part of. And we're happy to report, as Walker mentioned, that the indoor worker heat illness protection standard is now in place. 82 degrees, a two-tiered standard. At 82 degrees, workers are supposed to provide access to cooling, water, breaks every 15 minutes on the hour. If that threshold rises to 87 degrees, then the employer has to have in place some kind of cooling measures to maintain that indoor temperature at 87 degrees. And this is where we feel like cool roofs could go a long way to do that. All right, shameless plug.
Right. Thank you so much. That's really exciting, all the work that you've done to really bring that change to pass. So the next question is directed towards Dr. Cullen. How can we improve heat wave forecasting, early warning systems, and public communication to reduce HRIs and heat-related deaths?
So public communications is a stalwart of public health. I just want to remind people the three-legged stool of public health, which is assessment, assurance, and policy. And Matt talked about this before, the policy that's coming out of San Francisco. So assessment and assurance are all related to prediction. So we use the typical things and we communicate them to our I don't use the word residents or citizens anymore, the people that live in our community. With the CDC heat risk, you guys are probably aware of that. We do text messaging like other people do. People can sign up and get it. We have not figured out how to do blanket text messaging for individuals that fall within a specific area. But I think what you're seeing is NOAA, National Weather Service, CDC, there's an inordinate number of data sets that are being promulgated on a regular basis. The real issue is how do they get integrated into a fashion that the individual that seeing that data understands what the impact is for them as an individual and in their family and in their community. That is where there's a real informatics gap. I don't think the gap is in the data itself. We are a part, we were talking about this, we're a part of Brookhaven, and the DOE is out with Southwest forecasting, driving around, kind of like Google cars, driving around, mapping what's going on with the ambient temperatures at different times of days. Tucson is one of those. So we expect within 18 months, we will have very hyper local data once again, that on this street corner, your temperature, while your ambient temperature may look like it's 100, it's really 108 right here, probably due to multiple factors. But I think that that's where you're seeing the science is there. I don't know who's going to continue to pay for it, but the science is there, and it's really the integration of the different points to be able to do better prediction for the individual and the community. And I just want to reiterate that for a place like us, heat is, we live with heat. And so it's not an emergency. So this historical response, which was an emergency response to heat, is not going to cut it anymore for, I would say, for the world, definitely for the Southwest. Thanks.
Say a little bit about the wet bulb globe temperature as opposed to the heat index.
I can, because I wrote it down. The wet globe temperature of 96, 95. 95 is when we're all in trouble for the wet globe. That's an ambient temperature in most places of about 109. However, we don't record wet bulb temperature primarily. People just record humidity and they do a heat index. Most of you are probably familiar with the generation of a heat index. Titus, I really struggle with how to give one more point of information to an individual and how they can interpret it. So it kind of goes back once again to this standard stuff. What is the best way? And this human-centered design that was talked about the last center, what does the community need? What is the data point that they want to know for what they can do in their community? It's not that it can't be done. The issue that, you know, the last part of her question was about communication. And if we learned anything through COVID, it's that we can confuse everybody. So what do we do to make it, I don't want to use the word simplistic because I don't think it's simple, but how do we communicate some scoring that enables you to take action?
Thank you, Dr. Cullen, and thank you for your interjection to expand the conversation. Appreciate it. This next question, I'm hoping that both Walker and Enrique can chime in on. You decide your order. But what policy changes or investments are needed at the local, state, and federal levels to enhance heat resilience and to protect public health in our warming climate?
All right. I brought some notes up here. I wish this was all just in my brain, but it's overflowing. Okay, so I'm not going to offer. So a unique thing about our office is that we're actually non-regulatory. We don't create policies. We do a lot of science and research that informs other policies and other work throughout the state and elsewhere. So I'm going to talk about just some issues and gaps that I've seen, and some issues around heat and how it's sort of handled at different levels of government. And then I'm going to pass it over to Enrique to have all the answers and save us from all the problems I'm going to raise. So last summer of 2024 in June at Duke University, there was a summit called HeatWise. At this summit, it pulled together folks from all over the country, different sectors of public health, community-based organizations, insurance, banking, local, federal government, and so on, to talk about central issues related to heat. The report is live. I'm happy to share it with anyone who wants the link, or who if you've not seen it, or you could just Google HeatWise report if you don't want to talk to me. So three main things that came out that I want to talk about, just to touch on. One has to do with rural heat vulnerability. So we focus a lot on urban heat island, heat in city centers. Rural communities and tribal communities are really left behind a lot in this conversation as it relates to extreme heat. The sort of understanding of the issues and vulnerable populations in these communities is not well understood. The quality of our sort of data in terms of how what our understanding is of who's going to EDs or who's getting sick where is not well understood. And also, these people are kind of just left out of the conversation to sort of offer insight or solutions to decision makers. Another sort of solution related to this rural heat vulnerability issue was just the issue of we need to elect or appoint more heat officers nationwide. There's only a few heat officers across the country. These essentially can serve, especially for rural and tribal areas, as representatives, as voices of people who really understand these communities a lot better than federal level decision makers. The second topic was just about data gaps. There was wide consensus that we have a lot of really good data, a lot of sensor and satellite data, but without a coordinator, someone to take the data and apply it in the right instances to different communities, it loses its impact. And you need to be able to make that information translatable to communities and associated with change and associated with different policies. Another big one there is that there's a lot of great private sector data, such as insurance companies' data, such as there's a data collection company called First Street out there, First Street Foundation. A lot of great data. You have to buy it. So this issue of private sector data is really not utilized very well for public benefit. The last issue was on insurance. I talked about insurance a second ago, but also just wanted to mention this insurance related and a solution that came up related. It's called parametric insurance. And the concept of parametric insurance is that funding streams or funding mechanisms are basically activated for different communities, different sectors, and for different solutions based off of some kind of trigger or threshold. So with the issue of extreme heat, you would think about in a community, it's reached this certain temperature, it's associated with these certain health risks. Now there's this trigger for insurance that can fund this, and that really leads to saved money down the road. So those are some, issues, a couple of solutions, and I'll pass it to you, Enrique.
Thanks, Walker. So extreme heat, they say extreme heat touches every corner of California. That's just an example of the amount of policy that's needed to address such a diffuse and everyday occurrence. Before we can get to policy changes, though, there needs to be a lot more information and education around extreme heat. not just to our policymakers, but to the community as well. I know that the communities that I come from, as a former community organizer myself, I used to tout solutions must be community driven. I still think that's the case, with the caveat. Communities know where the solutions should go, but we need to make these solutions science driven. And as a result, we need to find a way to have experts gain the community's trust when it comes to the solutions that are time tested and that they're touting. Unfortunately, extreme heat isn't a very sexy topic, if you will, like wildfire is, with these just awesome pictures of destruction. And I don't mean awesome as in good, awesome as in just grand, coastal resilience or sea level rise, these amazing footage of 20-foot waves, destroying coastal communities. Extreme heat, as was mentioned, is a silent killer. And as a result, it's a hidden epidemic. And trying to amplify extreme heat is a really big challenge as a result. Everybody thinks that when it gets hot out, it's time to have fun, go to the beach, escape to the mountains. A lot of our community members cannot do that. And so it's incumbent upon folks that come from those communities to keep amplifying that. Legislatively, this year we had a win. We ran AB 2684. It was a bill that mandated local planning departments, upon their next update to their city's constitution, what's called the general plan, that they address extreme heat vulnerability in their communities. By doing so, they would align their local general plan with the state hazard mitigation plan at Cal OES, the Office of Emergency Services. Guess what? Cal OES gets federal pre-hazard mitigation money from FEMA. So there is about $1 billion in the state coffers available to communities to get ahead of the problem, to plan ahead and adapt their communities. Even though extreme heat is the third climate hazard of significance behind earthquakes and flooding, to date, California has received 1 award for extreme heat since the federal program was implemented. Part of the reason we're being told is at the federal level, the Stafford Act, which delineates the powers to FEMA as to what they can fund, doesn't address extreme heat. And so at the federal level, we are partnering with several statewide and national organizations to change that. Part of what we're doing around cool surfaces is we've organized a national level Shine On collaborative that brings philanthropy, that brings nonprofit organizations, that brings sectors that haven't been traditionally a part of the extreme heat conversation, like labor and public health, to the table. And I think that through that kind of organizing, through that kind of cross-sector collaboration, that gives us the best chance of amplifying extreme heat at the local, at the state, and the federal level.
Let's see, my organization has advocated for high albedo surfaces in our town to no great effect. And I'm just wondering if you had success doing that anywhere, say within California, any sort of restructuring building codes or modifications. So we're looking for high albedo pavement, high albedo roof, any of these things that would reflect as opposed to absorb.
Yeah, so like I mentioned earlier, our executive director, Jonathan Parfrey, started Climate Resolve over 15 years ago. Prior to that, he was the local director of Physicians for Social Responsibility. So he brings that public health, community-based solution approach to extreme heat. And in 2013, and it has to be science-based. So in 2013, some of my colleagues got together with folks from the Lawrence Berkeley National Laboratory, NASA JPL, MIT, UCLA, USC, and they started synthesizing all of these technical reports around cool surfaces and interpreting them and making them accessible to local policy makers. And I'm proud to say that in 2013, we were able to establish the very first cool roofs ordinance in the city of LA. 3 years later, we did it for the county of LA. And now we're trying to do similar work around cool pavements at the state level. We've hit a brick wall. In fact, that wall has fallen on us and smashed us to bits because there's no state agency that deals with physics. And cool surfaces is about physics. We have the California Air Resources Board. They deal with air quality, they deal with chemistry, but we don't have anyone in place to address the kinds of innovations that we are promoting. So that's another obstacle that we're looking to get over.
Thank you.
Thanks for your question.
Yeah, thank you for your question, and thank you so much for expanding on that. The next question we have is directed towards Mansi, and I was hoping you could explain how AI and machine learning are being leveraged to improve climate modeling and predictions, specifically and related to extreme heat events.
Sure. Before I answer that question, I would love to kind of pick up where Enrique left and talk about, we talked about policy changes and cool surfaces that can be, that are really helpful to mitigate extreme heat. And the awesomeness of cool roofs in particular, or cool surfaces, is that when you have a cool roof that reflects most of the sunlight back, you not only reduce the indoor temperature, so you have less need of air conditioning, you are saving on energy bills and the GHG gases because of the energy. But then if cool roofs are implemented at scale, or cool surfaces, high albedo surfaces are implemented at scale, you can reduce that urban temperature. And what we've been doing is we've been using AI to and high resolution imagery. So there are these satellites like the Sentinel-2 satellite, which has calibrated information about the Earth's surface albedo, or the amount of sunlight that's being reflected, but it is at a pretty coarse spatial resolution, at 10-meter spatial resolution. At Google, we have really high resolution access to really high resolution aerial imagery, satellite imagery. We can use machine learning to train models that can use the calibrated measurements from a low spatial resolution satellite and train a model to teach it to use the higher resolution model to then be able to very accurately estimate what the albedo of individual rooftops is. And so we've implemented a tool. We are piloting that tool for 15 cities globally, including LA. And we've really been inspired by the work that Climate Resolve and the Cool Roof Ordinance that was done in LA and Stockton, California, and other cities like Phoenix and Miami-Dade County. And our hope is that we can use this type of data to provide it to urban planners, to decision makers, to say, and then of course, equity is such a big factor. So when you have information on, here are the census tracts in my city, we aggregate that albedo information. We also look at tree canopy information. Here are the census tracts in my city that have a pretty low proportion of roofs that are already cool roofs. We also overlay information like the CDC Social Vulnerability Index, median household income, temperatures, to say where are the parts of the city where we should really prioritize these actions so that action can be taken. One more thing I'll say is that science is so important, and science-based decision making or data-based decision making is so important. We've in our user research that we did when we were building this tool, we spoke with many chief officers, sustainability departments, and again we heard two themes. One, equity is so critical, and then second, data pushes policy. I mean, of course, there's so much more to policy than just data. I can't even pretend to know all the challenges that happen, but data is so critical. So one thing that we recently built and we launched, and we are really hoping that can help make changes, we've built a model that looks at how increasing the proportion of cool roofs or high albedo surfaces in a city at a neighborhood level, as well as increasing the percentage of trees, how the local temperature can be reduced. So we use land surface temperature from satellites, and because it's available at a very high spatial granularity, and then we map the local characteristic, the microclimate of each region, the land characteristics, and then we can say that if we increase cool roofs by 20% in this particular region, increase tree canopy by 3%, the land surface temperature can reduce by 3 degrees Fahrenheit, or in some cases it's like 5 or 7 degrees Fahrenheit. And that quantifiable data, because there have been many studies, there have been many simulation studies that have been done that, Lawrence Berkeley National Lab, Professor Akbari, there's so many really great work that's been done to say that, based on these studies, increasing high albedo surfaces or trees reduce temperatures, reduce air temperatures. But when you have the data for your city, for your local environment, this is where you can, we talk to these analysts in sustainability departments. You can say, I can take this particular data, I can create a screenshot of how the most vulnerable parts of the city, we can reduce temperatures by increasing these high albedo surfaces. I can take it to the next city council meeting, present it, and that's when I can make a policy proposal that we should actually replicate what LA has done, what is being done in California, institute a cool roof ordinance, or provide incentives to developers, to roof installers, et cetera, for these high albedo surfaces. So our hope is that we can use AI to provide the data in the meaningful ways that it can help decision makers actually make the change to implementing policy.
All right, I think in the interest of time, we're just going to go straight to Q&A so we can wrap up by 5:30 and have our break. Any questions? Okay, let's see. You can go ahead.
Hi, I'm a psychiatrist, and I was wondering if the heat-related illness data includes mental illness. I think a lot of people aren't aware of the increased rate of depression associated with heat, the increased mortality for people living with schizophrenia who are in heat waves. And I'm just wondering if psychiatric hospitalizations and other mental illnesses included in the data.
At least in our county, that is included, and you are totally right. We see that. What's been difficult to sort out is the medication itself versus the underlying disease that the medication may be treating. But we do include that, and emergency room visits, which in our case is a crisis response. There's a large crisis response facility where most people are transported to. Those visits are included for us for what we're looking at. But it's a very good point, and thank you for pushing it up again.
All right, we'll try to get one or two more questions. I'm really sorry. I'm trying to, I saw this nice lady in the back.
Hi, Grace Kistner. I'm a nurse, and I do a lot of things through that lens. One of them is here at UCSF. I'm a fellow of the Earth Center, which has a Reach the Decision Makers Fellowship. And we're working on a project that addresses science that is looking at heat and also pesticides in a farm worker community, which I didn't hear a lot about yet at this panel. And we're going to be bringing some of the science to see how, for example, extreme heat can increase the volatilization of pesticides, and address Cal EPA agencies to see how we can take this science and improve farm worker health, considering how that crosses all of your specialties and everything in this symposium tonight. I just wanted to know any thoughts that any of you have. I won't ask specific questions. I would love to talk to each and any and all of you later on, but just any thoughts on that. Thank you.
I have one thought, and it's from some data that comes from Central and South America with the farm worker communities and these significant increase in end-stage renal disease, that people believe that it's pesticide, but it's also chronic dehydration in the field. And we see this in American Indian Alaska Native communities at the Notham and the Gila, where people live, where water is gold. and you're either transporting water, you don't have access to water. And so you couple that with heat, you get this chronic dehydration, you couple that with the pesticide exposure, all of a sudden you've really accelerated the onset of diseases that end up with killing you eventually.
I think someone had a question on the side. Yes, sir.
I had a question about the indoor heat standards that a number of you have addressed. So my question is, how were the numbers arrived at? The 82 degrees, the rise to 87, and then that would trigger a response. So would it be interested what the science was for that and how that's enforced? And also to have some insight into why prisoners were excluded.
Yeah, I shouldn't have mentioned that, huh? No, I can answer the second part of your question. The first part, I don't know the science behind it. I wasn't involved in that research, but I'm happy if you want to connect with me. I'm happy to connect you with the right people that were involved in that. The argument from, and other folks in the room might know better than me, but from what I know, the argument from the prison industry is that it would cost tens of billions of dollars to retrofit their prisons in order to meet that heat standard. And so they opposed it tooth and nail. And as far as I understand, they were able to hold up this indoor standard. And so the standard itself was revised until they were excluded from that part of it. That's all I know.
So if you go to Cal OSHA Standards Board website, just type in Cal OSHA Standards Board and it'll pop up. There's a staff report that was done for those two tiers. And in that staff report, you're going to find about 400 pages, a literature review of 400 pages that were done, not just for California, but nationally, trying to pinpoint the right temperature, maybe not the right temperature, but a good average that would protect indoor workers as best as it could. There was a lot of criticism from a lot of organizations and groups that a one-size-fits-all is just not the right approach for California with its diverse climates. But that was the sweet spot that researchers were able to come up with. And again, that literature review will put you to sleep. No, it'll give you a lot of information on that standard.
All right, go ahead.
I just wanted to briefly mention that federal OSHA is also taking comment on an outdoor standard right now.
All right, on that note, we'll go ahead and go to break. Thank you all so much. Panel 2.
All right. Thanks, everybody. We're going to kick off the final session for the evening. Really excited to be here with all of you today. Really been wonderful discussions around thinking about climate, health, and equity through the role of informatics and AI. And for this last session, we're going to pick up on a topic, a thread that's been mentioned throughout the earlier sessions. We hear about the tremendous promise of AI in addressing climate and health work, but we're also increasingly starting to see the concern around the environmental footprint of AI. So how do we balance the positive, the benefits of what AI can do for work in climate and health with really understanding what that footprint is and try to sustainably advance health AI? And so I'm going to kick things off with just a brief framing of the conversation, and then we're going to play a short video from Udit Gupta, who is a professor focused on sustainable computing, and then Anu, who's here, who Anu and I have been really working on advancing the space together, going to kind of help to guide you all through we're going to have a breakout discussion session, and then we'll wrap things up. And we also have a lot of people dispersed throughout the crowd who are helping to volunteer, lead the breakout group discussion section. So with that, really want to start with a lot of headlines that you might be seeing. We're starting to see all these headlines pop up really over the last year of the enormous footprint of AI, whether it's the exhaustion of the power grid, to the water costs, And a lot of these costs are a little bit still secret under the radar, but a lot of journalists have been trying to investigate and uncover what's been going on right now. And there's an arms race with trying to find power for powering all of this AI work. This graph from the Washington Post shows the cost of both electricity and water by using a tool like ChatGPT. It shows one 100-word email you send with GPT-4 consumes about a bottle of water. Also, it's about the same amount of energy needed to power 14 LED light bulbs for an hour. And that's because of the GPUs, the graphical processing units that power AI, and the water is needed to cool these because they get really hot. And when we talk about AI and energy use, there's a range. So AI, very broad umbrella term that can mean a lot of different things. You can mean basic statistical models to machine learning models that might predict the links between air quality and asthma. Then we get to deep learning, which are more complex AI systems, and large language models or generative AI are a type of deep learning AI that's more energy intensive because it's the processing power needed is greater. So just wanted to, not going to dive into any of this, but just to say when we talk about the energy implications of AI, it's not one size fits all. Some AI models can be pretty lightweight, don't use a lot of energy, but other tools, particularly the large language models, those seem to be the most power hungry. And so we're going to focus on one of those use cases tonight. Before going into the concerns with the environmental footprint of AI, I think it's also helpful to just talk about all of the places that AI can be helpful in the work around climate action. This is a report from BCG and Google about the different ways in which advanced analytics, machine learning, deep learning, large language models all may play a role in helping us make better predictions about climate and be able to take the associated action. We're also starting to see in the world of healthcare increasing examples of where AI is promised to make a huge difference. So in patient interactions, we're starting to see AI ambient voice tools where there's an AI listening into a conversation and generating a transcript or a clinical note. We're starting to see AI being used for messaging, and we're going to dive into that a little bit more. A lot of use cases across diagnosis, from AI reading X-rays to pathology slides, AI looking at lab results and helping make sense of that, helping make sense of the complexity of genomic information, and so on. Across all different facets of healthcare, people are very captivated by what AI can do. And I think it's important for us to realize there's a lot of work around the responsible rolling out of AI, the ethical rolling out of AI, making sure that it's safe, effective. But what we're here to talk about today is making sure that it's also sustainable. And so this has been an increasing point of topic. There's been a few events that are addressing this issue that we started to see picked up in the press. The National Academies is starting to have some workshops around the energy implications of AI across all of these different use cases. So we're starting to see more and more attention and awareness around this, but healthcare is in a particularly unique place to do something about this because healthcare is one of the largest customers of AI tools, and healthcare institutions have also been leaders in signing climate pledges. And these two things may be at odds with each other, but they don't necessarily have to be. And so what we're going to do today is we're going to dive into a specific use case, which is specifically around AI-powered messaging, or you can think of it as like a health chatbot. And this is basically the use of a large language model to automate messages that are sent to patients. And we're going to talk about this context, primarily in the context of one message that a clinician is sending to a patient. But you can also see how this gets extended to a lot of other health communication technologies. And more specifically, this is just an image of what this looks like. So if you're a clinician, you may be familiar with your inbox where you are receiving messages from patients you are taking care of and you have to respond back to them. If you're a patient, you might have messaged your doctor or other clinician and get a response back from them. Increasingly, this is one of the areas that AI is being applied. So what's happening, if you're not aware, at many health systems, GPT-4 or a combination of GPT-3 and GPT-4 are being used to look at the message coming in from the patient, and it's automatically generating a response that is for the doctor to review and then send. And the idea and promise of that is to decrease the burden on the clinician, but it does also raise a lot of questions around trust and in communication. We're not going to dive into all of those today, but really want to talk about this use case and the energy it takes and the environmental footprint of using this kind of technology. And just, this is maybe getting a little bit into the weeds of this, but just to show you how this works. So there's a message that comes in from a patient, goes into the EHR, and what they do in most of the implementations of this is that GPT 3.5 is used to categorize the type of message that the patient is sending. And then it looks at the other information in the electronic health record and then uses GPT-4 to draft a response to that the clinician then reviews. And so what we're going to talk about today here is, with this example, we're going to talk about how do we consider balancing the benefit of AI with understanding its footprint. And we're going to emphasize how small design and technical choices can have a big difference in impact, as many decisions about how we implement AI in healthcare are going to be baked into the system for decades. And so we really want to understand these sustainability implications of AI in healthcare in this context. And so with that, going to turn it over to a short presentation from Udit Gupta, who's a professor at Cornell Tech in sustainable computing.
Hi, thank you for attending this talk, especially on a Saturday evening. My name is Udit, and I'm an assistant professor in the ECE department at Cornell Tech. And today I really want to share with you how to think about the role of computing and AI and the broader climate impact that it has globally. To get started, let's take a look at what is the environmental impact of computing more broadly. Now, if we aggregate the emissions of all of computing from mobile systems, communication infrastructures, and hyperscaler data centers across the world, we find that computing accounts for nearly 1.2 to 2.2 billion metric tons of CO2 every single year. This is about 2 to 4% of worldwide emissions, and already on par with the entire aviation industry's footprint. And these emissions are expected to grow nearly double over the next decade because of the rise of new applications like generative AI and increasing demand for these applications and computing and digital infrastructure in our society. Now, to tackle some of the environmental impacts of computing, there's been a lot of interest across the research and the industrial community in order to think about how do we make our digital infrastructure greener and more sustainable. Just as a snapshot, recently, NSF has announced large expeditions in computing, targeting specifically how do we, from the ground up, think about this environmental impact of computing. My lab here at Cornell Tech is a part of one of these expeditions, a $12 million study over the next 5 years, and with collaborations with Harvard, University of Pennsylvania, California Institute of Technology, Carnegie Mellon, Ohio State, and the NSF. Not only are we seeing these sort of topics be really interesting to academics, but we're also seeing a lot of industry involvement. In fact, industry recently has pledged to be carbon neutral by 2030, whether it's companies like Microsoft, Amazon, Google, Facebook, Apple. Each one of these technology companies has pledged to be carbon neutral over the next decade. Now, carbon neutrality means something a little bit different to each of these companies. We're starting to see a real interest and eagerness from these companies to really think about what is their role in the broader climate discussion. Now, unfortunately, while a lot of these claims were made around 2020, we're starting to see the impact of generative AI and AI more broadly on some of these climate pledges. So these are two articles from Bloomberg over the last month. And what we see is, even though Google and Microsoft, and this is also true of other technology companies, but Google and Microsoft had made these technology pledges to be carbon neutral by 2030. And so they were expecting their emissions to go down year after year after year. However, around 2020 and 2021, with the growth and the exponential demand for computing from AI, we're starting to see that the actual emissions from these technology companies is rising. If you look at some of these sustainability reports, they actually cite the fact that the explosive demand in AI is one of the reasons, or the key reason, that they're not able to stick to their projected goals of being carbon neutral in 2023, 2024, and so on. So this really calls into question of how can we enable technologies to be more sustainable from the ground up, thinking about green software, green algorithms, green systems, and hardware systems as well. Now, why is AI demanding so much computing? Well, this is partly because AI is growing at an exponential rate. So here's some data where on the x-axis you're seeing time, and on the y-axis you're seeing model size, or the amount of compute that is required to train some of these systems. What we're seeing is that over the last 5 years, we've seen over 3 orders of magnitude increase in the model size and the corresponding compute demand that's required for some of these models. Because of this, AI is actually consuming a significant amount of energy as well. So the chart on the left that you're seeing is some data from the EPRI that's showing the amount of energy that data centers are responsible for in each state of the United States. Now, generally across the US, we find that data centers are responsible for 2 to 3% of nationwide energy consumption. However, in certain regions like Virginia, Oregon, and so on, we're actually seeing that data centers account for over 20% of the electricity being consumed on these power grids. This is actually expected to rise at a significant rate. Some projections are showing that in Virginia, we're going to have over 30 or 40% of the energy is going to be going to these data centers. The image to your right is actually an article from CNN about a month and a half ago that was actually showing a lot of these AI leaders are going to the White House to really discuss how can we continue to sustain the amount of energy that's needed for some of these compute clusters to support AI going forward. Now, when we think about AI, what I want you to think about are these key phases of machine learning systems. So the first phase is actually collecting the data and storing it to be able to train some of the models. The next phase is experimenting. What sort of model are you going to actually need and use in your systems and applications? The third is, once you know what the parameters of those models are, you can actually train it, and maybe you're going to fine tune it for the particular application use case that you have. And finally, you're going to deploy it or do inferences and use it in the wild. Now, oftentimes, as you're using this machine learning model or application, you're going to go back and you're going to collect more data that might inform you to do better experimentation and training, or you might use some of the insights, some of the data that you're collecting at inference time to continue fine-tuning these models. Now, historically, we've thought about the training cost of these models as being very, very significant. While I was at Meta for my postdoc, one of the things that we were looking at is where are all of the infrastructure demands coming from for AI, and what are the associated emissions from each phase of the machine learning lifecycle? And what we found was that training and experimentation account for about 30% of Facebook's emissions. Data collection and inference are about 30% for data collection, and inference accounts for 40% of the infrastructure demand. This is really important because when we think about green AI and sustainable AI, it's not sufficient to only think about training and experimentation. We also have to think about the end-to-end machine learning lifecycle. How are we collecting the data? How are we storing it? And how are we actually deploying these systems and using these machine learning applications in the wild? Now let's take a look at a particular use case that I believe you've been talking about, which is a health chatbot. So the idea here is that you might have patients that are coming and asking their physicians questions. And we want to use some of these generative AI capabilities in order to accelerate the process and allow these physicians to operate more productively. And so this is a quick way to start to think about what is the carbon footprint of just the inference phase, one of those first 3 phases that I mentioned earlier, and for this health chatbot applications. And so how we would go about quantifying some of these emissions is looking at how many physicians do we have in our health system? How many messages is every single physician going to be responsible for answering to? What is the size of the inputs that these models are given to process? What is the energy per query or per question that is consumed or required to process that question? And then finally, we multiply it by PUE, which stands for the power usage effectiveness. This is a measure of the efficiency of your data center, and the carbon intensity of the energy going into the server or the power grid that you're part of. So here I'm just highlighting a couple of the key parameters. So the green parameters, physician's number and messages per physician, are really about how we're using the system or the use frequency. The ones in red here, the input size and the energy per query, are the model cost. We saw that that was rising exponentially over time. And then the parameters in blue, the PUE and the carbon intensity, are really dimensions about the data center efficiency. So if you're thinking about, should we have an on-premise data center? Should we have a cloud data center? These are some of the parameters that you might want to be thinking about. So let's instrument this with some example numbers. So let's assume that we have 3,000 physicians in a health system. Each of these physicians is responding to 50 messages per day. And each query going into this chatbot is about 1,000 words. We're going to be using GPT-4. And our data center efficiency, we have a PUE of 1.4. This is about the average of hyperscaler data centers in the US right now, and a carbon intensity of about 300 grams emitted per every kilowatt hour of energy consumed. Once again, this is the average of the United States. When we plug these numbers in, we find that the system would emit about 120 kilograms of CO2 every single day, or 44,000 kilograms of CO2 every single year. And I hope this gives you a starting framework to start to think about how can we start to design a health chatbot, or how do we start to use generative AI and AI in our health systems, but in a more sustainable manner? What size model and model capability do we require? Should we have on-premise data centers or cloud data centers? How frequently are we going to be using and interacting with these systems as well? Thank you for listening to me. And if you have any questions, please feel free to reach out to me. I've provided my email and website link where you can find additional contact information for me. Thank you so much.
Thank you. I'll let him know you clapped. All right. Just wanted to reiterate the last slide that you just saw and also share one additional detail here. So when we looked at this, right, there's the use frequency, the model cost, and data center efficiency, this green, red, and blue. These are kind of the primary parameters we can work with. There's more details to them. But if you look at something like the model cost, right, there is GPT 3.5 and GPT-4, and we did some of these calculations with it. So you may find that in your own use, you might have used GPT 3.5 and you might have used GPT-4, and maybe GPT-4 is a little bit better than 3.5. But the interesting thing is if you look at the energy footprint, And these numbers are not, OpenAI doesn't publish these numbers. So we've done a lot of best estimates based on how we know the technology works and is structured. But our estimates show that using GPT-4 versus 3.5 for this use case is that GPT-4 has a 20-fold footprint over 3.5. And so this is, and we might have, there's GPT-5 potentially coming out next year. And so really this is at the crux of this, as we have these different models that are being used for different uses in healthcare, they may have huge differences in the energy footprint, but their clinical performance may be not all that different from each other. So what we want to do now is have just break up into groups. We have about 7 or so folks who are volunteering to help lead some of the breakout questions. So I just want to have them stand up. So Anu, Aiden, Tim, Jason, Trevor, Titus, Stefano, Malvika, and Shay. Thank you all for volunteering to help with this. So if you could disperse kind of evenly throughout, and then everybody sort of break up into into separate groups. What we want to do is take the next 15 minutes or so to talk about this, just get your thoughts around what you've heard, and then think about these 2 questions. One, what are the different parameters or decision points that health systems should consider when implementing AI-powered messaging from the lens of environmental sustainability? And then 2, how do we put these into action? Thanks, everybody. I know there's been a lot of really lively discussion. So we're just going to now transition to just reporting back from each group of what you shared. I know different groups sort of took the discussions in different ways, and that's really the idea here, is just want to get people to engage with this topic and think about the environmental footprint of AI. So I'm going to pass it over to Trevor to just share what their group talked about. And for the group leaders, if you want to just briefly introduce yourself too, that'd be great.
Okay. All right. Can everyone hear me okay? Okay. Nice to be with everyone. My name's Trevor. I'm a research associate with the Stanford Healthcare AI Applied Research Team, which is a lab. Should I wait? I don't want to cut people off.
Sorry, guys. Can you guys all pay attention? Thank you.
Yeah. Sorry, I didn't want to cut anyone off. I know there's a lot of good discussion that's happening. But anyway, as I was saying, nice to be with everyone this evening. My name is Trevor. I'm a research associate with the Stanford Healthcare AI Applied Research Team. We look for ways to integrate AI-based solutions in primary care and population health to try and improve the patient and provider experience more generally. I'm not a physician, obviously, but I come at this work as a young person and someone who is very passionate about climate change and for whom environmental damage feels like a very existential threat. With that in mind, every time I go to work and think about how AI is being leveraged in healthcare settings. We had a great discussion with my small group, so much so that we didn't get to the second question. So I guess just to recap, for question 1, we really felt like all of these sub-questions about which AI models are being used, balancing trade-off between clinical quality and energy footprint, where the models run, the sources of electricity, the limits to how many times the model can be used in a day or what times of day, are all kind of subsumed by the first order of business, which is this prioritization exercise. And so thinking about what identifying specific problems that we want to be solving within our health systems and healthcare institutions, and making sure that AI is actually the right solution for those problems. I think AI being the cool new technology of the day, we have a tendency in general to see a problem and say, oh, AI could probably be used to solve that. And the reality is that it could, but there are also many other effective and potentially more eco-friendly ways of solving those problems. So I think really all of these other questions about when should we use AI or what justifies the environmental footprint from these different AI tools that we could be using really comes down to what are the problems that we're trying to solve? Will they be used to improve the lives of providers and other healthcare workers? And yeah, I think that's the key takeaway.
Hey, thank you very much. I'm just going to go clockwise. I will pass it over to Titus, and you want to just briefly introduce yourself and talk about.
Yes, thank you. So Titus Schleier, I am the chair of the American Medical Informatics, Climate Health and Informatics Working Group. And it's great to see so many people from EMEA here. So 100%. Of course, as Jason will not be surprised about, we looked at the sheet and then immediately went off script. So I'll just give you a couple of highlights of our discussion. The first one is the question of how do you have the discussion about how to implement that technology? So the very important thing we came up with there is we really need to involve physicians, clinicians, patients, hospital administrators. It has to be a user-centered design process because there's going to be multiple perspectives on any and all of this. So that's item one, kind of a inclusive philosophy here. Item two is, and let me look at my notes, context. You know, did your health system sign a carbon-free pledge? What is the state of sustainability thinking in your health system? You know, if there's bigger fires burning, then introducing an AI assistant, you probably should pay attention to those first instead of kind of focusing on what, you know, is obviously one of our favorite topics. And then maybe last one is reducing cognitive burden. So those of you at AMIA, you know this, you know, it's like a mantra. We have to reduce cognitive burden, which means that let's not overload the clinicians more. You know, Lisa had a wonderful example. You know, she said, the computer, when I'm doing a code on a kid, so reviving a child from a life-threatening situation, and the Epic system shows me the price of what I'm just about to order for as an infusion, that's not helpful. You know, it's cognitive burden where it's least needed. And I think last, you know, we need to start thinking, and I think implicitly we have been starting to think of computers and people as human computer systems. And the borders are started to blur. And you see this with AI. Most people cannot tell, so they wouldn't be able to complete the Turing test, which I know some of you know, when looking at AI output. You know, they'll be like, yeah, some human wrote this. You know, the New York Times has great games about, you know, which video is AI generated and not, and which photo is. So I encourage you to play those. But the point here is, you know, we're starting to see this blending of computers and humans, and that is ultimately going to be a very disruptive period until we trust computers and computers trust us. So there's a lot of work ahead. Thank you.
Thank you. Over this way. I'll turn it over to.
Hi, everyone. I'm Anu. I'm an emergency medicine physician and a medical informatics fellow between Stanford and the Palo Alto VA. We had a small but mighty group, and we're also went quite a bit off script. I'd say that some of the themes that kind of came up were that these AI-powered messaging applications themselves are imperfect in ways that are sometimes kind of rather obvious, actually. And when we're thinking about how to implement them and the speed at which they've been implemented, thinking about the scale of that and the energy utilization for something that may not have been sort of optimized or fine-tuned to the extent it could be is definitely something that can be a little daunting. We thought a little bit about how, you know, one of the big drivers of these implementations is this consideration of efficiency. And when we're thinking about efficiency, how do we kind of make an argument that is kind of credible and viable to health system leaders that efficiency might not be the only parameter, or that we might need to think about efficiency from a broader context or perspective that might include things like the energy utilization of a model. We talked a little bit about how we might be hopeful that some of these models, like a lot of technologies, will sort of self-correct and might become less energy intensive down the road, but the time frame of that is not something that we might know right now. And a little bit about it seems like different health systems, especially ones that are leveraging a lot of these AI technologies, might have developed their own in-house kind of servers, data systems, and sustainability might not be something that they have as a forefront of their priority. And there might not be sort of global standards across multiple healthcare systems of how to do this the best way from a bunch of perspectives, compared to these gigantic hyperscaler data centers that places like Google and Microsoft have been leveraging, that really have been working on fine-tuning and optimizing every small component to yield a lot of sustainability benefits. So how do we develop those conversations, share best practices between healthcare systems, and sort of let all of the boats sort of rise with the tide on things like that?
All right, thank you. And I know some groups have multiple group discussion leaders. So Malvika, I don't know if you both want to introduce yourself.
Sure. Hi, everyone. I'm Aiden. I'm one of the pediatricians and informatics fellows at Stanford.
Hi, everyone. I'm Malvika. I'm a postdoc at Stanford and BA Palo Alto in biomedical informatics. We'll split it in half. So a few themes, actually I feel like what we're all talking about is super synergistic. We talked quite a bit about transparency, basically in identifying these decision points, these parameters. What are we really looking for? Is, for example, carbon the one way to measure this? In electricity, could we look at water? Are there other metrics that need to be considered? Then choice and privacy. When using these chatbots, do clinicians want to be using AI-powered messaging? Are there other more eco-friendly solutions like y'all talked about that they could be using for various solutions? Then are they really as good as they seem? Which is also a theme that you all mentioned. Is 3.5 enough? Is 4 really necessary? It's basically like 3.5s put together, and how much do we really need that? Yeah, and then we also talked a lot about global impacts and how all of this fits in with maybe under-resourced or low-resource countries or low-resource settings.
Quickly, I think the ways that we thought about putting these into action are, having governance councils at institutions to figure out what's like the actual job that we're trying to accomplish with AI, right? A lot of things don't need it, even though we think that it might. And then similarly, like finding out how to properly price certain things. I think, I paid $20 a month for OpenAI to get ChatGPT Premium, but is that like the true cost, right? That organizations should be paying based off of like an at-scale implementation, right? And thinking about on an institution level, how do we properly price things to incentivize the right move?
This sort of intersects with you all, the first group that spoke, but I think that a lot of this discussion starts with a lot of unexamined assumptions that the progress along these lines is the best way to go. There are other ways to organize our healthcare system, which are not like for the benefit of for-profit health and making these type of decisions. The money that would be going for this could perhaps be used to hire more healthcare workers and to look at a different way of organizing our healthcare system that would benefit more people and not have to put them, at the risk of just having everything done through chat boxes. There's a lot of energy uses that have not been discussed today, which include Google just contracting for 3 unproven small modular nuclear reactors to power their AI. Bill Gates just contracted to open up one of the reactors at 3 Mile Island. These are issues that have not been discussed and are just moving along to establish a reality. And I think we just don't have to have our eyes on all of these issues.
Hi, I'm Shay Andrew. I'm a hospitalist at Stanford and an alum of the CI Fellowship there.
Hi, everyone. My name is Stefano Leitner. I'm a physician at Kaiser. I did my occupational environmental medicine training at UCSF and then clinical informatics training at UCSF. And I started a company in climate health informatics with Chetan, the moderator of this whole thing, called CHILL, the Climate Health Innovation and Learning Lab. You can go over. Our conversation was really cool. It really started off with emphasizing the need for solutions, especially around things like physician-patient messaging and inbox management, especially for systems like Kaiser Permanente, where it's salary-based and there's no compensation for all the extra time necessary for patient response, and how these come in, pretty much throughout the day, and how there's a lot of metrics that are followed with how long it takes for you to respond to them. And these are people's lives, and they're asking like real questions. So there's an urgency, but also how does that impact the physician and the clinician in general? So there's clearly solutions that are necessary, and generative AI may be one of them. And as we go into the conversation around the energy consumption, one of the really interesting points brought up was, there may be a certain amount of energy consumption with this, but from the bigger picture, how does that play into patients not needing to drive to the clinic, or other aspects of energy consumption that aren't directly related to that formula that we saw, and really needing to do some sort of life cycle assessment to understand the impact of it overall. But that was a good point. Another one was, generative AI and large language models are really fascinating and sexy right now. And they may be a tool used for a lot of different use cases, but not every single use case may need this. And so better determining what use case is necessary for a tool like that was a really cool discussion and how to approach that. And then we have 3 physician assistant students with us from Stanford. It was really cool to hear their perspective about the role that they can play. One of the ones that was really cool is they have a lot of education around this, where they're actually thrown in and try to solve a clinical case using AI. And part of it was better understanding how awesome it is to use AI, but also recognizing the gaps and also the ways that there are hallucinations, otherwise known as false positives, where the AI may be giving you the impression that the answer is correct when in fact is actually wrong. And the other aspect is, early on having a solid education on this and then being able to share on this broadly is the things that we can do. So it was a really great conversation. Thanks everyone for this, and thank you for coming out tonight.
Thank you. Just have a few more groups. All right, it's going to pass it over to Jason.
Hi, everyone. I'm Jason. I am a clinical informatics fellow at University of Washington and Seattle Children's. I'm also a general pediatrician. We had a great discussion. I think I'm going to try to summarize just the highlights, because I think there's a lot of things that we covered. But I think one of the first things we just talked about was how right now the implementation for these messages is that by the time a provider or clinician has already done it, has already seen it, or even if they're not going to use it, that calculation has already been done. Like, that is the design of how these models and this implementation has worked. And so it really brings up the point of how do we as informaticians and climate folks really think about design of these like aspects when we are trying to implement them? Can we control these different pieces? And right now it's not being driven that way. So I think being able to put our minds together from talking about all the things from today, like, data-driven design, it's really thinking about how do we actually put those metrics on first of all, saying, what is the carbon emission? What is even just anything that's being done? And then second of all, can we even change any of those pieces, which I think is where I'm hearing all these rich discussions. We had a large conversation around being able to have a lot more input from patients and really, a community-driven design, thinking about like, is this ethically the right thing from both a patient standpoint? Do they really want their messages to be, if they're going to have a specific question for their doctor, that it's going to be, mostly or entirely bot driven? Or do we even know that it's going to impact and help people that need it the most? We make a lot of assumptions that people who are reaching out because they're rural, they're, in a place where they can't access care, that they're using these kind of MyChart or in basket type messages. That's something that they're going to do. But I think those are very much assumptions. And again, that data driven, is this the right people that we're actually impacting? Is this the right health outcomes that are actually being improved? And putting those at the forefront of our decisions and being able to and understand, like, when we make those upfront decisions from a contract standpoint, how does that actually play out?
Thank you. And going to pass it over to Tim.
Hey everyone, Tim Saib, a clinical informatician at Stanford, one of the associate medical directors of our HEART team, so our healthcare AI applied research team at Stanford, working on the implementation of this tool and also now doing the qualitative analysis of the tool. But our group had a very rich discussion, very much reiterating a lot of the kind of ideas and topics that were previously presented. But we started by focusing on the physician impact of, do the physicians want it? Is it an effective tool? Is it time saving? Is it cognitively saving? Which is a really important aspect. And then another factor is transparency, like we talked about. So the amount of carbon emissions and putting that in perspective of bottles of water, electricity, I think is a great way to characterize and summarize, what is the impact of these types of tools. And then the previously mentioned use of the tool and appropriateness, right? Having a large language model doing a task that a multivariate regression model can certainly do, or if we're looking and moving towards, the growth of AI tools, and do we necessarily need a large language model? Do we need 4.0? Do we need, or can we leverage, an older model, or even a simple, multivariate regression model? Was kind of very much our kind of trajectory of our conversation. And then when we're thinking about putting these recommendations into action, we thought about the policy level. So, are there intersections with government, industry, academia? Certainly there are some challenges moving forward with getting those opportunities, and also, is there consortiums and other organizations to help push those and make those more public and more transparent and visible, and then also evaluation upstream. So when we're thinking about implementation of these types of tools, there's health systems that have yet to implement these tools, and then there's health systems that have already. So in the evaluation of AI models, can we think about the sustainability and carbon emissions as a variable and a factor to consider? If we're looking for RFPs from different companies, can we ask for a sustainability evaluation of their model, and how that factors into like a health system's strategic plan, right? And then for the health systems that have already implemented these types of tools, a transparency component. So can we show our providers or the end users or system leaders that these types of tools create X number of kilograms of carbon dioxide or water, electricity, et cetera? And because I think a central theme of what I was hearing from our group was, if we don't know, we're not presented this information, we don't really think about it, right? And so as a user of these draft messages, seeing the calculations and then thinking about managing my in-basket and the times that I've used the draft reply certainly puts a different perspective on it as well. Thank you.
All right, thank you everyone. Really appreciate all the engagement. I know it's a new topic for many people and maybe start to get a little bit more technical, but hopefully it brought up some new considerations and perspectives of how to think about this. And I'm going to just turn it over to Anu to just wrap this section up.
Great. Yeah. Thanks, everyone. And really wonderful to hear all of these perspectives. I'm just going to take a few moments to kind of consolidate a lot of the topics we've reviewed today in this session and think about some next steps moving forward. So we learned in a little more detail about how artificial intelligence models can have a really substantial energy and carbon footprint, and where that footprint comes from, what the main drivers of that could look like. We understood that healthcare systems are implementing AI in a variety of different ways fairly rapidly and across a lot of different domains. And we know that health systems contribute substantially to the carbon footprint across the US. It's about 8%. And we also know that a lot of health systems, including most of the ones in the Bay Area, have made these commitments to reduce their carbon footprint. And we've seen AI drive other organizations like Google and Microsoft to sort of fall off of that curve. What can we do to prevent our health systems from falling off the curve because of AI? How can we align the implementation of these models with these commitments that these health systems have made? So we talked about the main drivers. We talked about who the stakeholders are and what conversations need to be had to add this lens of sustainability to discussions around how best to implement AI and how to balance this concern around sustainability with a number of other concerns that everyone here brought up today about the best ways to go about implementing AI in a healthcare system. And then I think a big question is, how do we message this? How do we advocate this? How do we take it from this room into whatever systems we're working in and start to have these conversations with folks that may not be familiar with or as interested in these topics? So what are some of the next steps that we're hoping to do as part of this work? So I think the first, and Dr. Sai made a great point, that you can't really advocate, you can't message until you know. You don't, unless you have that information, you can't really start to make change. So I think a really big and interesting initiative is going to be starting to think about, how do we develop a framework similar to the one Dr. Gupta shared, and perhaps adapt it so that we can share it with colleagues across different health systems and start to track and understand what the impact of these models are and what the biggest drivers of that impact are. How do we work together with groups like the Medical Society Consortium, like the EMEA Climate Health Working Group, with all of the people who are in this room today that have such broad and interesting ranges of influence, to develop guidelines around this, develop policies, and then how do we advocate and message that for the people who are going to be making decisions around these models, which are really going to be leaders in our different healthcare systems, and how can each of us have a role in that advocacy depending on our skill set, our interests, and our background. So as part of that, would love to have anybody in this room who is interested in working on this topic down the road. We are trying to put together a little bit of a coalition. We are hoping to build, with Dr. Pillai, potentially a bit of a tool to start tracking these emissions across different models and across different healthcare systems. And your input, your thoughts are going to be really crucial to that. If this is something you're interested in working on, we would love to have you involved. And this is just a quick QR code to give us a little bit of information that we can then use to share. And if you guys have other thoughts, other questions, other domains that you want to work in this space, there's an area for you to input that. And then you're always welcome to contact myself or Chetan. We're really at an interesting and exciting point to make a difference in this space across a lot of healthcare systems and a lot of models. And it's going to take a coalition to make that happen. So we're really grateful to you all for sticking around through the end of the session, and look forward to seeing where this space takes us. So thank you so much for your time.
All righty. Thank you all so much for being here this afternoon and evening. I don't want to take up too much more time. We appreciate you all being here. I did want to thank Lisa Patel and the Medical Society Consortium team, Lucy Walker, I'm not sure if she's here, also Savannah, who's been helping online. We couldn't have done this without you all, so thank you. And Kelly, yes, I was about to talk to the student moderators. I wanted to give a shout out to all our student moderators, Kelly, Anjali, Pedro, and Christina. Thank you guys so much for doing a great job. Our panelists, thank you so much for participating. And the NorCal Symposium Planning Committee, I know we have a couple of members here. Thank you all for your guidance and your direction. I think this was an amazing event. Hopefully we can continue this again next year.